all. We've got some speakers we'll get to. I believe we're streaming live. And this is the May 28th, 2021 edition of Community Public Services Committee. I will now start with roll call of committee members. Councillor Zadok, I think I saw your name there. Oh, I see him online, but not responding. We'll circle back. I know that Councillor Zadok had a few things to attend to this morning, so this may be part of that excused absence. Okay, Councillor Knack.
Good morning.
Good morning. Good to hear your voice. Councillor Nicol.
Good morning.
Good morning. Good to hear your voice. We've got, I see Councillor Henderson is with us this morning. So good morning to you.
Yes, ma'am. Good morning.
And Councillor Banga, good morning to you.
Morning.
And I also see Councillor Scott McKean. Good morning.
Mr. Chair, good morning.
Very nice to hear all of your voices. All right, so we've got an interesting agenda this morning. Would someone please move the adoption of today's agenda?
So moved.
Thank you. That has been moved by Councillor Nicol. Please vote.
We have all the votes.
Please display the vote. And that is carried unanimously. So I believe Councillor Zadok is with us. Good morning, sir. Okay, so would someone please move the adoption of the minutes from the previous meeting?
Yes, thank you, Mr. Chair. I'll move the adoption of the April 28th, 2021 Community and Public Services Committee meeting.
Okay, any debate on that? No, I read them with great interest and they are accurate. So I will vote. Please vote.
And we have all the votes.
Please display the vote. And that is unanimous. Thank you.
Mr. Chair, this is Councillor Zadok. I just wanted to say I've joined by phone due to technology issues.
Yeah. Well, thank you for joining us. We appreciate having you here.
Yeah. And I've been able to follow along and vote through my iPad, but I'm here. Okay.
Perfect. All right. So at this point, we will now select items for debate. So that is open. And if you would like to select some items, please just throw your name up there. And if it's not working for you, just
Yeah, it's not working for me, Councillor Paquette. So, can you hear me, Councillor Paquette?
I sure can. Go ahead.
Okay. So I understand we have speakers on 6-1, 2, 3, 4, and 7-1. So I think it's everything. Is it not?
That's the whole kit and caboodle. Yeah.
All
right.
Okay. Rock and roll.
All right. So all the items on the agenda have been selected by Councillor Nichols. So please vote.
I'll move all other items, sir. 5, 1, 2, and 3.
Oh, right. Yeah. Thank you.
Yeah.
We've got the
I
revised.
apologize. I'll move all other items.
Okay. Thank you for catching that. Yeah. Please vote.
We have all the votes.
Thank you. And that is carried unanimously. Okay, so moving on with great aplomb. I did not ask if there are any protocol items because I wasn't notified in advance. So
Mr. Chairman, the clerk needs to read back what we passed.
Yeah, can you please read back what we passed just now?
Thank you. This morning, Community and Public Services Committee has passed the following items without debate. There's been 3 revised due dates approved. 5.1, State of Immigration and Settlement in Edmonton Annual Report, revised due date June 30th, 2021. 5.2, Assisted Transportation Plan of Action, revised due date August 25th, 2021. And 5.3, Policy Options for Alternative Financing Tools, Recreation Centers, revised due date November 2021.
And that is what I have as well. Thank you very much. And as I was saying, I skipped local items, but that's because I hadn't heard any. So just in case anyone's wondering. Okay, so we actually have some requests to speak this morning. I don't know if anyone else has the list, but I do. But if you'd like to hop in to make that recommendation. I'm not hearing any volunteers. Okay, so I move that Community and Public Services Committee hear from the following speakers and panels when appropriate. On item 6.1, Maria Garcia, Glynis Lieb, Dave Chown, and Emily Garcia. On item 6.2, Paul Andrews, Matt Bakowicz, and Alice Cameron. Item 6.3, Ron Olstad, Christine Kowalczyk, Raquel Farrow, Elvira Falconer, Nathan Vinema, Cheryl McCumsey. And on item 6.4, Cara Bedford and Elise Graham.
Mr. Chair, we also have a speaker on item 7.1 that wouldn't have been included on your distributed list.
Okay, I did not have that. Item 7.1. Do you mind reading out the name?
Mary Dumais.
Mary Dumais. Okay, great. So to hear from these speakers, please vote.
Councillor Zadok? Councillor Zadok, it's *6 to unmute if you're on your phone.
He may have lost his connection. Okay, well, we'll just display the vote then, as is. And that is carried. Okay, so we actually have requests for time specific on the agenda for two items. First is item 6.1 is the first item of business, and then item 6.2 as the first item at 1:30 p.m. And so if there are no objections to that, please vote.
Councillor Paquette, those were set by Agenda Review Committee, so we don't need a motion.
We don't have to vote on it. We're already done. Okay, I remember doing that. Okay, thanks. And then, and by the way, I will mention that that the 1:30 p.m. was requested earlier by Councillor Knack in the week, and so that was actually quite helpful. Okay, so let's move on. I was not informed of any councillor inquiries, but I will open the floor to see if there are any. No, and we already dealt with reports to be dealt with at a different meeting and request to reschedule reports. So we will now move on to item 6.1 as approved in the Agenda Review Committee.
Good. Thank you, Mr. Chair. We do have a verbal presentation this morning.
Okay.
I would first like to introduce our presenters. We're going to have Jenny Kane. Jenny is the director in the Social Development Branch of Citizen Services. Mark Snattersey. Mark is the Executive Director of Addictions and Mental Health with Alberta Health Services. And Gary Pugliandla. Gary is the Executive Director of Canadian Mental Health Association of the Edmonton region. And for questions later on, Mr. Chair, we have Leanna Chandro, is a social worker from our Social Development Branch. Glenn Close from Edmonton Police. Tony Boyko. Tony is the Mental Health Coordinator from Fire Rescue. And finally, Cheryl Faraday, General Supervisor of Bridges, Structures, and Open Space Maintenance from City Operations. So following approval of the high-level bridge barriers, City Council directed administration to work with the community to develop a suicide prevention plan. Living Hope, a community plan to prevent suicide in Edmonton, was approved by council in March of 2018. Funding to support the implementation of the plan was subsequently approved in April of that same year. We'll now invite Jenny, Mark, and Gary to provide an update on the plan to committee. Over to Jenny.
Thanks very much, Rob. Well, in a year of many pandemic-related challenges, Living Hope, a community plan to prevent suicide in Edmonton, has progressed really well. All of the priority actions have been underway since year 2, and a number of them are at or near completion. This sustained progress is due to the incredibly strong community-based implementation team. It's a solid collaboration of over 45 community organizations, including the nonprofit sector, different orders of government, and individuals with lived experience. And the City of Edmonton continues to play a key role in the implementation of the plan. Some of the key achievements that I wanted to highlight associated with direct city funding include the following: the positive survey results for the public awareness campaign, the intent of which is to reduce the stigma and increase awareness of how to effectively respond and support those considering suicide. So I'm hoping that some of you will have seen the 11 of us messaging on billboards and social media. The provision of suicide prevention training to community members and to service providers, and a total of over 1,500 people were registered in virtual and in-person training between October 2019 and April 2021. And the evaluations that we've done on the training demonstrate an increase in participants' ability to identify, assess, and support those at risk. Thirdly, the shift of the expanded men's support groups, knowing that men in particular are at high risk of suicide. And that work has included the men's drop-in group, the coping with anxiety and depression group, and men's sheds. And those shifted to online formats that continued to be well attended. The community-based implementation team has advanced its work with higher risk populations by partnering with the Institute for Sexual Minority Studies and Services, with the Edmonton Two Spirits Society, and Shades of Color, who co-developed complementary projects that were intended to reduce the suicide risk of queer, two-spirited, Black, Indigenous, and people of color. Collaboration and funding was also provided for a unique dedicated 211 support line for LGBTQ2S+ people. Other collective achievements include the co-development of a lived experience peer support network, sponsorship and co-planning of a national suicide prevention conference, and support for commemorative events for bereaved families. In addition to fostering these wonderful local relationships, the community-based implementation team has maintained productive partnerships with both provincial and national organizations. These partners have shared needed connections and expertise that has really enabled the engagement of our local work. Additionally, we've been working with LRT staff and pharmacists in means reduction efforts, and that's provided opportunities and have had opportunities to advocate for the national 3-digit crisis suicide prevention line. I'm now going to turn it over to Mark Snattersney to talk about Alberta Health Services' ongoing role in the implementation and support of the plan. Thanks. Over to you, Mark.
Thank you, Jenny. So my key message is Alberta Health Services has been involved from the onset of the development of the plan, and we remain a very committed partner in the implementation phase as well. Within Alberta Health Services, both addiction and mental health, as well as our provincial injury prevention program, continue to provide a range of services that support Living Hope. Some of these include ensuring that senior AHS leadership is represented at the leadership level of this plan, funding the full-time project coordinator position that has been supporting Living Hope, supporting the participation of frontline staff and management in many committees and working groups, providing suicide prevention education and training for staff, physicians, and the general public, providing access to data through our injury surveillance dashboard, hosting a suicide prevention community of practice, and of course, sharing access to all the internal expertise we have within Alberta Health Services concerning suicide prevention. We're also continuing to make advancement in access to addiction and mental health services in Edmonton that have direct implications for suicide prevention. Access 24/7 has now become firmly established as our single point of access. It's our main front door for anybody seeking addiction and mental health services, making it easier for our citizens to navigate the addiction and mental health system. These and future investments from AHS will continue to advance the implementation plan's objective to increase the accessibility of mental health interventions, training, and capacity building. So now I'll invite Giri Pulagandra from CMHA to provide his comments as well.
Thanks, Mark, and thank you for the opportunity to speak today. So the Canadian Mental Health Association Edmonton Region is committed to building a community of hope, support, and inclusion, and to create stronger communities, smarter systems, and simpler journeys for people dealing with mental health issues in Edmonton. Beyond our leadership and collaboration within Living Hope, CMHA has provided data, suicide prevention training, bereavement supports, 211, and distress line services, all of which have been necessary for the implementation of the plan. Multiple community partners also continue to provide significant in-kind contributions of time and expertise, including ourselves, and notably Alberta Health provided an additional $450,000 in grant funding for suicide prevention activities that are aligned with the National Roots of Hope Suicide Prevention Project. Collaboration and coordination of aligned work with community partners will continue in year 3 with emphasis on strengthening partnerships with service providers who support Indigenous peoples, incorporating findings from a GBA Plus analysis, hosting and sponsoring events that promote well-being for men and LGBTQ2S plus youth, sharing of first responders, best and promising practices, and disseminating suicide-related data. Sustainability planning for beyond June 2022 has already begun. Most contributing agencies and organizations have indicated that they will participate in the next version of Living Hope. In fact, I can't think of anybody who said that they won't. The community-based implementation team will soon begin a process of engagement, prioritization, and planning in preparation for a subsequent plan, particularly in light of the impacts of the pandemic. The pervasive impact of the pandemic on Edmontonians' mental health and well-being has further elevated the need for a community-wide response to prevent suicide. Survey responses and calls to the distress line demonstrate that a higher number of people have considered suicide. One national study suggests 1 in 12 people are having suicidal thoughts and feelings now, compared to 1 in 40 before the pandemic. This is as good a reason as any that our work needs to continue, if not escalate. The bright spot in all of this is that our partners are motivated to build on the momentum we've gained through Living Hope. To this end, we'll continue to increase awareness, enable collaboration, and bring communities together to prevent suicide. Thank you. We'd be pleased to answer any questions you may have.
All right, thank you very much. We will now move to our speakers, and then after our time with our speakers, we will return to administration for questions. So first on the list, we've got Maria Garcia. And I see Maria is on the line with us, but perhaps we'll move back to Maria and talk to Glynis Lieb. Glynis with us?
I am. Good morning. Thank you so much for the invitation. I just wanted to take a moment to speak in favor of the Living Hope project and in favor of continuing it. As was mentioned, I represent the Institute for Sexual Minority Studies and Services, and we have been involved since the onset when Lon Jones reached out to look for folks for the steering committee and to discuss what this was going to look like. At the time, they were talking about recognizing folks with extra vulnerabilities, and there were a number of groups identified. Through conversation we had, ended up breaking out those groups into specific groups, including the 2S LGBTQ community, which I represent. And I've been involved with a lot of initiatives, a lot of awareness building initiatives, and that over my time working in mental health and addiction type field. And this project is what I'd hoped to see a long time ago. It's a project that actually focuses on tangibles. I really appreciate the 11 of Us campaign, but I appreciate more so that we're actually doing things. And what has been mentioned is the new dedicated support line for the 2S LGBTQ community. That is monumental, and folks in the community have been advocating for that for years. And the simple recognition that if you're someone who does have a higher vulnerability, but also has added complexities of having to feel like you have to justify your identity, your situation, and that to the person you may be calling for support. That is a huge barrier to seeking supports. And this dedicated line is going to be monumental in supporting our community. I'm so excited about that. I'm so excited about the fact that we have developed youth peer support programs with the support of this project and funds through the city that are directly supporting queer and trans youth. Who we serve them directly, and we have seen such a monumental increase in mental health problems, in overdoses, in precarious housing or homelessness through the pandemic, and through suicide and suicide attempts. We see this every day, and we're seeing that the supports through this project and the funds that we've received they're helping us save lives. And I can't say that emphatically enough. My team is saving lives. There are times when my team does upwards of 15 active suicide interventions a week, and this is on queer and trans youth in our community only, right? So this is so important to me. I feel so passionately about it. I love the work that's being done to focus specifically on Indigenous peoples within the queer and trans community, but other Indigenous peoples as well. And the fact that this team has worked so hard to actually put the people that they are trying to support at the helm of dictating how this project works. I love the fact that we're focusing on men too in this province. We know what a struggle this is. We know that coming out of this pandemic, the psychology of disaster tells you that coming out of this pandemic, we are going to see a rise in acute mental illness and suicide and other struggles over the next 6 months to 3 years and beyond. We need to be prepared for that, and Living Hope is actually doing tangible things in the city that are going to help us be prepared for that response. So I can't praise this project enough. I can't praise Lon enough for his leadership and his desire to do more than produce reports. And I want to really, really plead with the city to consider extending this project into the second phase. And so thank you very much for your time.
Thank you, Dr. Lieb, and you're right on time. So thank you for that. Let's just circle back to Maria Garcia.
Hi there. Sorry about that.
Yeah. Go ahead. You have 5 minutes. The floor is yours.
Okay. David Garcia was just 26 years old when he died. He tragically committed suicide on the evening of August 28th, 2020 at around 9 p.m. on the same day that he was discharged from the Royal Alex Hospital, where he spent the final 2 weeks of his precious life. He jumped off the northwest side of the high-level bridge, but only after a 7-year arduous and long battle with his mental health and an untreated case of complex PTSD. In order to tell David's story properly, however, I must go back to his childhood. David was a gentle and sensitive boy. Wearing his soul on the outside, he wore no exoskeleton of falsehoods that so many of us wear in order to protect ourselves and fit in with the rest. Being so authentic, however, rendered him painfully vulnerable to an ever so superficial world that is not taught to covet such things. In the last 7 years, David's mental health soared downward to ever more darker places. You see, he, myself, and my siblings endured severe child abuse. My mother was emotionally, mentally, and physically abusive, and both of our parents neglected the toll that it took on our innocent bodies and minds. Can they hear me? Okay. I always knew David's decline and dissociation from this world stemmed from our childhood. To this day, none of us have ever been able to reconcile what happened to us. Can I finish? Thank you. We all tried to escape it in our own ways. Carrying the weight of a broken heart far too early, David buckled under the pressure. At school, I prayed that students and teachers would be kind to his gentle and special soul, knowing that the atmosphere that awaited us back home was none of those things. Sadly, the world was not kind to David. This included teachers and peers. Frustratingly so, he did not become jaded or hardened by the bullying and rejection of others, only more hurt. Evidently, the 5 of us would go through the Edmonton public school system unnoticed. We all attended Jasper Place School and did not receive support or intervention from our teachers, counselors, or community, in spite of the signs that we incidentally displayed. Upon graduating high school, David began to isolate himself. Weeks to months would go by where we would not hear from him. After a while, we started to normalize this behavior. He pushed us away from his pain in order to protect us, believing that it was better to suffer in silence, and not realizing that we were doing the same. Eventually, he became incapable of outwardly expressing how much he indeed cared, white-knuckling his way through life. We could only watch as the invisible and impenetrable walls went up. One can perhaps imagine how the alienation must have exhausted the spirit out of him. In high school, he naively formed bonds with people who did not have his best interest at heart. He relied on the deceitful acceptance that he thought he found in them, this allowing him to fall victim to the pressure of his peers. The multitude of events that he endured enveloped him in a web of guilt and toxic shame. In an attempt to intervene, my mother began to admit him to hospitals for help, though her attempt was tenuous. Thus began a saga of hospital visits, police interventions, and various diagnoses, trying to ascertain what could possibly be so wrong with him. This would also mark the beginning of the horrendous cocktail of drugs from a myriad of doctors, which only aided in altering his reality further and played to feelings of isolation and lack of normalcy. No one gave him the proper attention that he needed. Nobody could see that he just needed a friend and his dignity back. Unaware that the truth of his pain was his childhood, buried deep in his subconscious and locked behind my mother's iron lips. 7 years ago, David would first speak of his intentions to jump off the high-level bridge. That means that for at least 7 years, we, all of us, had the opportunity to save his life, or at least prevent this tragedy from occurring. Days after his death, we as a family visited the bridge. We gathered there, enveloped in hopeless grief, at the very spot where his feet firmly stood for the very last time. I wanted to be as close to my brother as possible, so I lowered my head, and with painfully bittersweet ease, I managed to stand between the barricade and the railing of the bridge. As I grasped the railing, looking down at the spot where his body lay, the realization that the barricades were simply a facade washed over me. Today, I humbly speak before you, requesting that we change the way we think and speak about mental health, and that we add to the barricades of the high-level bridge, and that you help me and my family take the ripples that David created and turn them into waves.
Thank you for that. Thank you for coming to share with us today.
Thank you.
We'll move now to David Chown.
Okay, I guess I'm done.
Hi, thank you for the opportunity to speak today, and thank you, Maria, for sharing David's story. My name is David Chown. I'm co-chair of the Community Mental Health Action Plan, and I'm a member of the Living Hope Steering Committee. I'm pleased to speak in support of Living Hope today. The Community Mental Health Action Plan proudly joined efforts with Living Hope a few years ago to ensure members of our community have access to the help they need through better coordinated mental health systems. Together, we've developed resources, tools, training to support suicide prevention and positive mental health. This includes development of the mental health training framework, a Need Help for Mental Health tool, and a soon-to-be-released information sharing tool. Another recent example of our work together was the collaboration to bring the Connecting the Dots documentary to our community. In early February, we partnered with Living Hope to provide a virtual screening of this film, which offered a raw and intimate youth look at youth mental health. We were one of the first communities to host a screening of this film in Canada, and it's a great example of how we've been able to leverage our resources and our relationships to reach a broader audience with important messages about mental health and suicide. Close to 200 families and caregivers from across the Edmonton area joined online to watch this film, and the community's response to the film is continuing to create positive change. After this event, 6 schools in our region were inspired to come together to host a screening of the film to open up the conversation about the growing needs in schools. The Edmonton Public School Board also made the Community Helpers program available to all Edmonton Public junior high and high schools to train and empower students to help prevent suicide after viewing the film. The work the Living Hope teams have completed in such a short period of time is both humbling and inspiring. Even in the midst of the challenges of COVID-19, Living Hope is reducing stigma and advancing mental health support for members of our community. Our efforts together are complex and ongoing, and we hope to continue promoting mental health awareness and education and ensure mental health services are accessible and available to those who need it most. To me, there's no question that the Living Hope team are saving lives in our community. It's an honor to be a part of this important initiative, and I'd like to thank the City of Edmonton for their continued support as well.
Aaron, you have to turn on your mic.
Thank you. We'll now move to Emily Garcia.
Hello. Can you hear me?
Go ahead, you have 5 minutes. Yeah, we can hear you.
This speech was difficult for me to write, so I'm grateful my sister was here to help speak about David and be so well spoken. My brother was one of the most caring people I will ever meet. At a young age, I remember seeing his shine, running a marathon for school and making great achievements in his fitness journey. I remember him traveling to Ecuador to build homes and schools where he made meaningful connections with people and even had some children asking for him years later when Maria went to do the same work. To his core, David was a caring and creative soul with so much to offer his community. As his mental health declined over his last 7 years, so did his shine, till I only caught glimpses of my brother and how his true nature was. His mental illness mainly showed up as dissociative behavior, which affected every aspect of his life. I believe that focusing on negative outcomes leads to confusion, but if we are educated and made aware of the right signs, it will save lives. As my sister mentioned, we struggle to reach out for help dealing with the repercussions of complex PTSD. When things were too much to bear, the help he encountered was not only unhelpful, but damaging, as many of the ways public services are set up neglects to care for someone struggling with their will to live. I can attest to that after seeing the stigma. I can attest to that after seeing all the stigma, misinformation, and barriers public health services has to navigate through from my own experience searching for help after my suicide attempt at 14 years of age. What we needed was programs like Living Hope to have access to professionals who are familiar with the specific help needed. Awareness must grow and educate the public in knowing what steps to take to move forward for the person in need and the supports around them. Only weeks after David's funeral, where people were afraid to speak about suicide, our cousin Christopher hung himself at 18 years old. No one noticed the telling signals because we as a society are not taught them and shy away from conversations around it due to stigma. David had so much going for him, so much skill and passion. What he lacked was a will to live, because it wasn't taught to him. It wasn't taught to any of us. Silence and shame kills. We must be taught that life is fragile and there is strength in vulnerability, and that speaking out in a safe place will break the barriers that stands between us and the love and connection we all truly deserve and need. That's it.
Well, thank you for that. Thank you for coming to share with us today. It's truly appreciated. We have the opportunity now to engage with you, and Councillor Nicol selected this item. I'll just check in first with Councillor Nicol.
No, I'll defer to Councillor McKean, please.
Okay. Councillor McKean, please go ahead.
Yeah, thanks, Mr. Chair, and thanks, Councillor Nicol. And I, just as a little bit of background, I've met twice with Maria and previously with her siblings on this, and it's one of the most affecting stories I've ever encountered in my life. And I just wanted to tell Maria and Emily, you were very brave, and you did such a great job today in sharing with us David's story. It was very powerful. You did a real honor to him and his story. Maria, have you had an opportunity to talk to the Living Hope team, and would you welcome that? So the experts that are working on our suicide prevention strategy. Just wondered if, I don't know if you've had that opportunity and whether you would welcome that opportunity.
I would certainly welcome it, but unfortunately I have not had the opportunity yet.
And that could be something that we will be able to facilitate. And we'll follow up on that. I think there are so many different points in David's story where there were perhaps opportunities for David to be sort of brought in from the cold, if you will. Ultimately, what do you think we need to hear? Like, what did David, it sounds like he needed really special treatment, I guess is the word, at the right time. And like, so he was in the psychiatric ward at the Royal Alex, I imagine, just before he took his own life. Do you have any idea what might have changed this story, his story?
I think if I could jump in on this quick,
Sure.
I think that David needed his dignity. He was in a hospital gown, and there was somebody going through somebody pretty violent beside his bed. He didn't have any privacy. He was in a gown, and he wasn't able to interact with other people, especially during this COVID time. So David just needed someone to talk to, and someone that understood what it is to be questioning your will to live.
Right. And yet go ahead, Maria. Sorry.
I also wanted to add, along with what my sister Emily said, is that I don't think that we were targeting the core, which stemmed from our childhood. My mother was was the first point of contact for all doctors and counselors, anyone who helped David. But my mother wasn't saying what was actually happening, or what caused David to become so dissociative and jaded. So no one really knew what the issue was, and that led to impartial diagnoses like schizophrenia or borderline personality disorder. But nobody was especially my mother, she was not saying what was really happening and what had happened to him.
Thank you too again. You were very brave this morning, and I'm going to ask some questions of administration about the situation that you are facing, and look forward to seeing you near the High Level Bridge when you honor David this summer. Ms. Lieb, I think you're still on the call. So are you still there, Glennis? There you are. So what has been the change and the important change and maybe messaging we've been making as a culture to LGBTQ youth in particular, which I understand have really high suicide rates? Are we starting to get the message across to them that we care, they matter, whatever it is, that is the really important message?
That's a great question, Councillor McKeon. And I think that we're starting, I think there's progress being made in the sense overall that, that there's more conversation, and that's across the board. But I think that, from my view, some of the most significant advances we've made in the last couple of years is to actually talk to people about what their experiences are, rather than talking about what people's experiences are. And I keep saying this, I can give you all the theoretical background you need. I've, studied human behavior for almost 20 years, but I can't tell you what somebody who's having the experience of being a youth who has been ostracized by their family, gets picked on when they walk down the street because they're visibly queer. I can't tell you tangibly what that feels like every day. I can tell you that theoretically. And I think where we've improved in the last couple of years is the fact that we're actually letting people be experts in their own lives and tell us what they need. In the work that we've been doing with Living Hope here, we're talking to members of the community. We're talking to youth. We're talking to Spirit and queer Indigenous folk about what they need. One of the outcomes of this project so far was to work with E2S to talk about what do you actually need. And you said, we need connection with our elders and knowledge keepers. We need the ability to talk to knowledge keepers who identify as part of the Two-Spirit community. And so we said, great, we don't need to, this doesn't require paying for training or anything like that. What they wanted was the ability to connect and have people to connect with them. And that required providing protocol, providing transportation, connecting people to each other. And that makes a huge difference. In the work that we've been doing with our other programming, we let youth develop a program for a support group for other youth. The other thing that, that we've missed, and we do this across the board, is we miss the voices of, we tend to take a few voices to represent entire communities. And those are often the voices that have the most privilege and, and the most access and so forth, rather than recognizing the diversity of people, whether you're talking about youth, whether you're talking about 2S LGBTQ folks, you need to recognize the diversity in that community. And what's working for, a middle-aged adult, with a home and employment is not the same, their stressors are there, the stigma's there. It's not the same, though, experience as somebody who is, 18, who's QT BIPOC, who is precariously housed perhaps, and who is, very, having to navigate these systems. So that's, I think, the big part, that we're hearing people, we're listening to people and taking the time.
Thank you. And I'm way over time. So I'm going to, if you don't mind, I'm going to stop you.
Absolutely.
Thank you.
All right. Thank you, Councillor McKeon. Councillor Banga has some questions.
Thank you. Thanks, Marie and Emily, for sharing your painful story with us. And I guess I shouldn't be calling it a story. It's painful, as it is. My question to you would be, where do you think is the biggest gap? Is it the social acceptance of folks? Is it awareness, or is it treatment? Like, where can we deploy our resources in your mind to make sure that we don't see these tragedies.
I was thinking that. Sorry, can I jump in?
Yeah, you go, Emily. You go.
I was thinking that one of the biggest things that was hard to deal with this was the unknown, not knowing different signs of mental illness, not knowing what to look out for, not knowing what the mental illnesses are. I think that education and awareness is so important because even treatment can help that person, but awareness, just like David was released from the hospital, if we were all made aware, we all understood what was going on, we could have been better prepared to care for him. So I definitely believe awareness is one of the biggest things that needs to be worked on.
Okay. Maria, you have any comments?
Yeah, if I may add, I completely agree with Emily, but also I think that long ago, teachers could have, maybe noticed some of the signs that David was displaying. Sorry, I'm so nervous. He was a really shy boy, and he was bullied not only by students but also by teachers as well. Michael A. Kostick specifically, I just think that honestly, I don't know. I don't know what we could have done. And maybe if teachers had noticed his behavior was a little off and maybe questioned, what was going on at home, maybe that could have helped. But then when he was under the care of doctors, I found that the only way that we could really figure out what was going on with David at the time was through our mother, who was also, the abuser. And she wasn't informing the doctors properly with what had happened to David in his past, and also he never had a congruent treatment. He didn't have congruent treatment. It was broken up between the University Hospital and the Royal Alex, and I know he went to Access 24 and he was denied continued care because of a missed appointment. It was just all broken up, and no one was staying focused on his case. So he would have a psychosis, he would go in for care, and then he would be released. And then it would happen all over again over the course of 7 years. And he never had one doctor with him the whole time. It was just, he was being passed along through the system, and slowly but surely he lost more and more of his identity and more of his dignity. And it was, at one point he was almost homeless. My little brother took him to one of the homeless shelters downtown because he had exhausted all other resources. Like, that should have never happened. Sorry,
Okay.
that helps.
Thank you. So, Dr. Lee, the same question for you. Where do you think we need to, concentrate our efforts? I know they all have to be, all the aspects are important. Where do we concentrate?
Systems. Whether we talk about, physical health and dieting or mental health or racism or whatever it is, we need to be looking at the systems. And we have been working on advocating for public attitude change around mental health and addiction for years, while still operating in systems that, by the virtue of how they work, create an artificial divide between what we consider to be physical health ailments and mental health ailments, and with that stigmatize what we consider to be mental health. Their health is health, and we need to start treating it as such. And if we have public health care that provides care for health, it provides care for all health matters. The idea of having easy access or easier treatment to care for things that are considered physical health ailments. My my partner's listening in and said, who's a physician and is listening to these ladies tell their story about the disjointed service and said that would never have happened to somebody on dialysis. Why is it happening with somebody with mental illness, right? What, in this system, right? And so we need to look at how our systems serve everybody and the messages that people get when interacting with our systems. We know that when we talk about attitudes around mental illness, one of the areas in which people experience the most discrimination and the most harmful discrimination is in the healthcare system, because most people with mental illness will interact with the healthcare system and other services first, clinics, emergency rooms, and so forth. We need to focus on how our systems work. Our systems are perpetuating inequity and stigma.
Okay. Thank you so much.
Thank you, Councillor Banga. I'll just check to see if there are any other questions for our speakers. Not hearing any. I've got maybe a couple questions. Listening to the words of our guests today, the Garcias, and hearing their experience in our current system. It's an experience I've heard many, many times. And so I believe that our plan is a good piece of the puzzle. But what do we really need?
Yeah, exactly. Great question. Great question. The plan is a good piece of the puzzle because it gives voice to folk like you've just heard, who can legitimately explain the experiences that loved ones have had, that they have had, and actually get it heard on platforms like this. And we have to keep doing that because we still have systems who aren't listening to the people that they need to be listening to. And I said this when I first spoke. We listen to experts, we listen to theoretical conversations a lot, and those tend to get the most weight. We hear people with lived experience speak in venues like this, and then we take that information and go back around to experts and initiatives and so forth. We need, and until we actually do value the voices of regular people with experiences such as these, and actually look to them for expertise in what we're doing and listen, because there's no one solution that fits everybody. But the idea is that we're talking about these and we're having these conversations all over the board. Look at Bell Let's Talk Day. Look at that. We're having these conversations. It feels really nice. But I've done a ton of work in workplaces and in other environments, and people on the ground still say that although I would be sympathetic to somebody else, I still don't feel like it's okay for me to talk about this to my family, my workplace, my boss, etc. People still aren't there. And when the rubber hits the road, we still aren't there in supporting people properly in workplaces, in healthcare facilities, etc. We still aren't listening to people. We still place value judgments based on youth, socioeconomic status, race, etc. that compound these problems. And until we actually really change the attitude and the priorities within processes and that within our healthcare systems, our social services systems, this isn't going to change. We're going to keep hearing stories like this because, in addition to systems not working the way they should, people not being resourced the way they should, we're still listening to the stigma that people experience. And I'm listening to these two ladies talking about this, and there should be, it doesn't matter, what you label somebody's experience. They should get the same respect and treatment. If I tell you I have a broken leg, versus if somebody tells me I have borderline personality disorder or psychosis, it should be treated with the same respect, the same urgency, and like a health concern that we are addressing and that we can mitigate. Until we do that, we're going to keep having these feel-good conversations, and people like their loved one are going to keep dying, and that's the reality that we're facing here.
Yeah, thank you. It seems in many ways that on a societal level, it's not okay to not be okay as far as mental health is concerned, but we make great allowances for every other sort of illness or challenge that we're facing if it's physical. So, as you said, there's a lot of feel good, but the rubber has to hit the road somewhere. And so we've got this piece of the puzzle. And I guess to back it up, my staff and I have been talking about this issue, and we thought, like, how do you make things safer? How do you remove the opportunity for people to have a spontaneous, moment? And we went so far as to even think about nets to catch people. And that's when the light went off, and I thought, why do we have to construct these physical nets when we can construct a societal net and an actual programming net with proper funding? But that's outside of the city's purview.
It is. I think and I think to you, one of the things I admire most, and I've said this to you before, is your ability to take issues that reduce the likelihood that they will come into contact, they will experience this kind of outcome when it comes to suicide attempts or completion. We know these things, right? We know that having access to services that are, from an early age, such as even public health nurses, what does the research shows? If a family has access to a public health nurse from birth until kindergarten, and that reduces the likelihood that that child and that family will become service involved by upwards of 70%, right? Catching things early on, right? And this is what we need to do. We need to start spending proactively. We need to start thinking about things proactively. We have all the knowledge and research. We don't need to be just putting Band-Aids on reactively. And you're right, nets are something, but we can't follow people around, stopping them once they've become so desperate. We have to look at, what are we doing that is allowing them to get to that place of desperation in the first place? What are we not doing? What are we not providing as systems, as communities? And this is, this is relevant to all levels of government, to all Edmontonians. What are we doing as communities, as systems, as services that are not supporting people in the way they need to, that increase these likelihoods that they'll get to this point?
Well, thank you, Dr. Lead. Thank you, David, or Dave, and Emily and Maria. Thank you very much for coming and sharing the story of David. And just know that we've definitely heard you.
Thank you.
Thank you. So we're now going to be moving to questions for administration. But thank you again. Okay, so Councillor McKeon, please go ahead.
Thank you. And Ms. Quinn, you first. I think I know what your answer will be, but would you agree to have a chat with Emily and Maria about their story, just in case there was things that could inform the Living Hope strategy?
Definitely, we would welcome that conversation. And again, thank you for sharing your story today. As Bliss and others have said, it's really important that we inform our work with lived experience. And I'd very much welcome a conversation with you to look at how we could do that.
So, Jenny, it came up that teachers might be really good monitors of mental health issues, especially with their students. Are the school boards involved with Living Hope? I'm trying to remember.
Yes, the public school board is very involved, and as someone mentioned previously as well, we've just had an expansion of the community helpers program. But we are working closely with the school board, and as well, a number of the trainings are oriented to gatekeepers, so people that are in positions to be able to support people at risk. And the training, as was mentioned, there's been over 1,500 people that have gotten the training.
I don't think you're the one to answer this, but I'm asked this question because the Garcia siblings, and there was one other case that was brought to me of somebody being able to get around the barriers on the high level bridge. And I guess what I really want to know is that we're monitoring that, checking for vulnerabilities, seeing if there's been any damage done that would make it easier to get around the barriers. Do we do that annually or more often than that?
Councillor, we have Cheryl Faraday from Bridges and Structures on the call.
Thank
Cheryl,
you.
maybe can we jump in on that question of Councillor McKean?
Good morning, everyone. Yes, we do have eyes on the bridge in multiple different ways through our annual inspections of our bridge inspectors, reactively through 311 notifications, and then also every spring our bridge crews go on the bridge to check the cables to make sure they're tightened again from any slackening that happened over the season. Aside from that, our crews are on the bridge for multiple different reasons, almost weekly, mostly for graffiti removal. And every time they do a walkthrough to make sure everything's intact.
So, Cheryl, we've heard stories of people being able to get around the barrier. Do you have any explanation for that? Is it, I mean, maybe we couldn't make anything impenetrable, but do you have any, I don't know, the Garcias were really, their story is very poignant and made me feel really bad, and I'd love to be able to give them an answer, and maybe there is no absolute answer on this, that everything is, you get past anything if you're motivated enough or something. Any thoughts on that?
Yeah, we call them climbing deterrents. And like you said, sometimes it's inevitable for people to find their way. Most of the time when we see cables cut for people to access through, it's actually our rescue services that are doing the cut to access people to help them. The only other access point that we have seen tampering is through chain link fence at the top deck trolley, where people are accessing the top deck.
Thank you. And Maria, I see you put your hand up to speak, but the chair would tell you that that part of the meeting's over. We'll talk further about this. Don't worry. We'll continue to talk about it. Mr. Snattersby, I wanted to ask you a question because it is my pet theory, and maybe you'll tell me I'm wrong, but that we're going to have a tidal wave of mental health issues coming out of this pandemic. And I just wonder how Alberta Health Services and others are preparing for that. Are there plans? I strongly believe in community-based peer support groups, that sort of thing. And are there any plans to increase the amount of supports in the community? Because I think there's going to be a lot of hurt.
Yeah, that's an excellent question, and that's actually been on our minds for the last year. We know from numerous incidents in the past, whether it's fires or floods, that traumatic events have a negative population health impact on people's mental health. And the way that we've been thinking of COVID is, we're just coming to the end of our third wave of COVID, and its physical impact on the population. Really, the final wave of COVID is going to be this wave of mental health needs that the population is going to have. Yeah. We've been thinking about that and planning for that for many months. We know that we need to push out more services into the community. The investments that we're going to be making are going to be focused upstream on community programs. less so on acute care and hospital programs, but really trying to push the resources upstream so that we can prevent the emergency visits and we can prevent the inpatient admissions. We're looking at our models of care. How can we leverage? We've learned a lot in the past year about delivering services virtually, like we're meeting today. And our clinicians have actually become very adept at reaching out to more people using these kinds of virtual technologies. So with the same amount of staffing and resources, we're adapting our models of care to actually be able to reach more people and to be able to reach people in their homes and to do it in a way that is just maximizes access. The other thing is that we need to recognize that Alberta Health Services is not the only game in town when it comes to addiction and mental health. And so it really needs to be a societal movement. And everything we do needs to be in cohort with our partners. There are some incredible partners out there. The City of Edmonton, a fantastic partner, the City Police, a fantastic partner, schools, other nonprofit agencies like CASA. So really, it has to be a societal movement, and it needs to be, and that's what I really appreciate about the Living Hope. What the City of Edmonton has done is you've created the venue for so many community partners to come together on this, and the work that we've been doing over the past year, or a couple of years, it's critical that it continues over this next year, as we struggle with this next wave that's coming.
Thank you.
All right. Thank you, Councillor McKeon. Councillor Banga, go ahead.
Committee member, Councillor Nicholas.
Go ahead, Mo.
No
problem.
Thank you, Councillor.
I see. Sorry, Councillor Nicola, your name just popped up on my screen.
So anyway, my question is for probably Jenny or Mark. I mean, you heard the same, from Garcia siblings about their dealings with suicidal issues, problems in regards to their brother. We all probably had some experience in one of these issues. My question to you is, when a family goes through such a traumatic experience, who does the follow-up on and what kind of follow-up do we do?
So I can speak on behalf of Alberta Health Services. When a tragedy occurs like that, every one of those incidents are reviewed. And in fact, one of the most personally impactful meetings that I've ever had was with the Garcia family back in September. And I meet with, it's part of my job that I meet with families and I hear their perspectives after tragedies like this have happened. And every time we view it as a learning opportunity. What can we do from a system level? Glenn has talked a lot about systems, and we always try to view these kinds of tragedies through that system lens. And certainly there's always learnings and there's always changes that are made in these kinds of incidents. So we do take every opportunity to learn, to try and hear from the family perspective. It's really invaluable to hear from families, because to read a medical record or to hear from our clinicians is just one very small side of the story. The families are the true caregivers, and we have to listen to them. And so I can say that it's hard for me to talk about individual incidents, but globally we try to view all of these through that lens of learning and how can we work better as a system.
Okay, and then you discussed that it has to be a societal movement rather than any agency led. But in your mind, rather than, I guess, we can, the society should know, but how do we train the whole society rather than just individual, say, any agency on individual basis, and then they disperse their knowledge and expertise.
I would say you've just identified our biggest challenge. It's something that we're continuously working on. There are so many partners out there. There are so many providers. There's the private psychologists out there. There's primary care physicians. There's just a wealth of nonprofit agencies doing incredibly great work. There's Alberta Health Services. There's Covenant Health. There are many, and then there's the entire spectrum of social supports, community and social services, housing. All of these things, all are part of has to be all part of the ongoing strategy. So, I would just say that it's our continuous effort to try and bring partners together, so that we do have consistency, and we do have, we want the family experience, the client, the patient experience to feel like they're part of the system, whether they're being seen by one clinician or they're being seen by 3 or 4 or 5, which isn't unusual. And so it's a challenge when you have, just in terms of governance, so many players involved. But it is our continuous challenge to behave like a coordinated system.
Thank you.
Thank you, Councillor Banga. Was that your phone making the sound? I don't know. Anyway, it was right on time. Councillor Nicol, go ahead.
Well, I am on to put the recommendation on the table. Mr. Chairman, so moved. If there are any other questions, they can go ahead.
Okay, the recommendation is on the table. Well, I guess I will have some questions then. So the good news is increased coordination. But one thing that I was wondering is, as far as equity of accessibility and of approaches, do we have demographic numbers on what these rates are that would help us inform or help us to be informed on how to approach these situations in a more holistic fashion?
Maybe Gary, are you okay to jump in on that one, Gary, from CMHA?
Actually, I think it is a better question for Mark, but from my understanding is we're still waiting for updated numbers since last summer.
I can say that data is a challenge, especially when you're looking at, there are certain interventions that you can put out there for the entire population, but we know that there are vulnerable populations that are at higher risk. And that's where the data becomes a challenge, because really suicide data comes ultimately from vital statistics. And a lot of that information is fed through the chief medical examiner's office. And even though we know from research that suicide rates of certain populations is higher, it's actually difficult to validate that in the data, because we will often not identify somebody by their gender or by their orientation. It's not a question that's often asked in our databases. And so while we absolutely know that the LGBT community is a higher risk population, we have to adapt our data collection to be able to actually validate it and give numbers to it so that we can track it over time. And the same thing can be said for new Canadians, could be said for Indigenous populations, whether they're living on reserve or in the urban settings. So there is some work that needs to be done to be able to provide more detailed information on those populations that we know are higher risk, but we need to evolve our data collection to be able to really measure it over time.
Yeah, okay. And all right, so that presents a bit of a challenge then, doesn't it? If what we're talking about is measurement, because that which can be measured can be improved, but if we're not measuring, how do we know if we're actually making an impact? So I guess the next question then that would follow that is, does this have to do with trust in institutions, societal pressures, or a sense of belonging to a community to be able to disclose that information? Because it seems to me that a lot of the issues that we're dealing with have to do with alienation in many ways and discrimination. So I'm just wondering if you could speak to that.
Yeah, those are actually all very extremely valid points. We know that there are groups out of there that are less likely to reach out for help. There are groups out there where populations where stigma is more prevalent than in other populations. And so we need to be cognizant about that, and we need to adapt how we outreach our services. And whether it's certain ethnocultural groups that are identified, we're doing it right now with the vaccinations, and we'll continue to do that with addiction and mental health services as well, to try to work really closely with those communities to listen and then to understand how we as a system can do a better job of reaching out and welcoming and engaging people who might not instinctively trust government institutions. They've come from countries where they have very good reasons not to trust. And so we need to be able to understand that, appreciate it, and then work with those groups to try and engage them in a way that's more culturally appropriate for them.
Right. But also, I mean, folks who are just, I mean, to be frank, older men who also might feel that sort of alienation. So I would assume that's what makes it tricky. It's not just cultural. It's not just gender or orientation. It's not just age. It's an incredibly complex issue that runs across all sectors.
Incredibly complex, especially when the largest at-risk population is actually middle-aged men, and that's a societal bias that population has, that it's difficult for them to reach out for help. So really important things to think about.
Okay. Thank you. I don't think we solved it, but we're getting there. Appreciate that. Councillor McKean, you had additional questions?
No, I was just going to speak to the motion.
Okay. And if there are no other questions, then go ahead.
Yeah, excuse my stream of consciousness on this, because there's a lot to say. First of all, I wanted to thank the Garcia sisters for coming out today. You know, this Living Hope project has been, I think, a really amazing, it's been amazing work, and we brought a lot of people together. But I think what Maria and Emily reminded us today is there's still miles and miles and miles to go. And I think, Mr. Chairman, I think you hit the nail on the head when you said how complex it is when we're dealing with all those different sort of groups within our society. And you know, as an older white guy, I can tell you that, you know, we were raised in my generation, unfortunately, with a sort of dated form of masculinity, and that is to not speak of fears and things that we're embarrassed about or resentful about or ashamed about, and those things can just fester in the mind of a man who refuses to reach out for help. It is so complex, and we have, as I said, a lot of work to do here. I lost a friend when I was about age 20 who took his own life, and even the data, like, that was not recorded as a suicide because the family refused to see it that way, even though it was pretty clear cut. And so how often does this happen and we don't even realize it and it doesn't show up in data? I'm really worried coming out of this pandemic that we're going to have a lot of people who are really suffering after a year of isolation and loneliness. And I think it is incumbent on us to find ways in our city to establish maybe some safe places and spaces for people to talk. I don't know how we do that, but we have some really good partners here, Canadian Mental Health and Alberta Health Services, school boards, that sort of thing, that we might be able to tap into and find some ways to pilot some support groups out there. So I know we've done that with men's groups and things, so that'll be a challenge for us as well. Jenny Kane has been such an inspiration for me in my office, the work you've done on this, along with your team. I don't want to forget them. So I want to thank you all. And Jenny, I know you'll follow up with the Garcias, and there may be more that we can learn there still from that story, which is so heartbreaking. And there's, dozens and dozens and dozens of these in a city like ours every year. And last thing is, I think of the 3 men who died by what seems to be an overdose in a Boyle Street Park last weekend. And you can say, well, how is that related to this? Well, having attended thousands of 12-step meetings myself, people in there often refer to addiction as slow suicide. It's just taking your own life one drink at a time, or one injection at a time, or one exposure to meth or whatever it is at a time. So these are so, mental health and addiction are so interrelated, and people who are suicidal will often reach out to drugs and alcohol to try to calm those inclinations and try to keep themselves away from the high level bridge, but they don't, as we know, always succeed. Again, I think that I wish I could remember the date, but we will use our social media to talk about it. But my plan, and we'll encourage others, is to meet the Garcias in Ezio Ferron Park at the end of August to honor David. And I just wanted to say to Emily and Maria that I think you honored him in such a proud and glorious way today. I hope it relieves a little bit of your pain, knowing that you advocated strongly for him today and told us his story. Mr. Chair, thank you.
Thank you. You've moved me to say a few words, Councillor McKean. When we talk about the issue of suicide, it's something that no one really wants to ever touch because it's such a horrifying thing to consider for many people. And for other people, they see it as their only solution. And we really have to wonder why we have systems in place that allow people to even consider it as a solution to a problem. And I believe that that's rooted in silence, in shame. And that shame isn't just for the person who might be feeling hopeless or useless or like a burden, or that the weight of the emotional toll of what they're carrying due to mental health issues is just too much to bear. And it affects every family, every person. If you do not know of someone who took their life, then you are very rare in our world. And that's deeply disturbing. I asked about demographics because one thing we can do, I think, if we get a handle on this, is see why people suddenly feel like they don't matter or that they don't belong. And that seems to be the thread that connects it, whether it's cultural, whether it's institutional, whether it's age, whether it's sexism, whether it's gender issues or identity. All of these things, their root lies in the fact that people are made to feel like they are not important. People are made to feel shame. People are made to feel embarrassed. People are made to feel less than. And anytime we perpetuate that on another person, we are guilty. That's my feeling. And so if you wipe away all the politics, if you wipe away all of the societal issues, what it comes down to is what makes another person feel okay with making someone else feel not okay. And if that's the way that we're operating, we're doing it wrong. I'm really grateful to our administration. I'm grateful to all the people in our community who are working so hard to make a difference. And you are making a difference. This is a serious and heavy issue, but you're making a difference and you're allowing people to feel lighter, brighter, that it's okay to laugh, that it's okay to reach out for help, that it's okay to take care of their mental needs the way they would take care of a broken arm or blurred vision or whatever it is. And I'm just so grateful for my council colleagues who really believe in this, who've been working hard at it. Councillor McKean has been tireless on this issue. And I really want to thank the members of the public who came to speak. I want to thank Emily and Maria, because your story is a story that we can all relate to and all share. And when we can normalize the fact that even our harmful behaviors are rooted in mental health, and even people who perpetuate harmful behaviors need help. If we can normalize that, then we can start to normalize all sorts of things and make it better. So thank you again, everyone. And I'm ready to vote. I'm not seeing anyone else on the board. So please vote.
Councillor Zadek?
Now, I know Councillor Zadek did have an appointment this morning, so he may not be with us at this point.
Thank you. We have all the votes then.
Okay, please display the vote. And that is carried. Thank you, everyone. Okay, we now are moving to item 6.3, weed control program. I believe we have a presentation available, and then we have speakers.
Mr. Chair, I believe there's an additional speaker we need to add to the speakers list for 6.3, and so I can move that we add Marcus Wilhelm.
I missed that. Thank you. Please vote to add Marcus Wilhelm. Or actually, I'll just ask if there are any objections. Not hearing any? Okay, we've got Marcus also on the list. Okay. And away we go, administration, take it away.
Good morning, Mr. Chairperson, members of committee, members of council, and speakers. With me this morning is Brian Simpson, our branch manager of Parks and Road Services, as well as Phil Harrott, our Director of Infrastructure Operations, and Travis Kennedy, our General Supervisor of Open Space Operations. We're here today to discuss some of Edmonton's most treasured amenities, that being our shrub beds and horticultural work. When we talk about these areas, I think most people might picture a hanging basket or a flower bed in a park. But in reality, these spaces are much more than that. They're a benefit for our local ecosystems by providing homes for pollinators. There are sources of beauty in our parks and along our roadways and in our neighborhoods, and we want them to continue to be that way. Our presentation today is based on the direction from the December 9th, 2020 City Council meeting, in that City Administration provide a report on how the reduction in funding to the weed control program will affect protocols around future weed control, in particular, the policy to use the least invasive methods first. This morning, we will discuss how the funding reduction and associated shift of integrated pest management resources to focus on a proactive routing, inspection, and control of regulated weeds meets our regulatory requirements, as well as the City of Edmonton's integrated pest management policy, and are also in direct alignment with cosmetic herbicide restrictions. These operational changes will enable administration to focus on managing the control of regulated weeds. As we use herbicides in a targeted capacity, non-regulated weeds in these shrub beds will also continue to be an issue to be addressed. I'll now pass the presentation over to Mr. Kennedy, who will walk you through the approach that we are proposing.
Thank you, Gord, and good morning. We take pride in caring for our open spaces. We work for Edmontonians every day to maintain more than 202 hectares of shrub beds throughout the city, keeping these spaces healthy and vibrant while working within our resources. Shrub beds in the city are separated into two categories, A and B level shrub beds. Today we are discussing adjustments in operations for B level shrub beds, or those around roadways, parks, and in our neighborhoods. This adjustment in service level does not affect A-level shrub beds or those in high-profile areas like citywide parks, recreation centers, and attractions and business improvement areas, which receive 5 mechanical weed pulling visits per year. As part of the fall 2020 supplementary budget adjustment, City Council approved a reduction in funding in horticulture services associated with taking an integrated pest management approach that will reduce manual and mechanical weed control, but increase routing, inspection, and control of regulated weeds on our B-level shrub bed inventory, utilizing herbicides when deemed necessary. Commencing this year, this change will result in an annual ongoing savings of $1.14 million and ensure that the city can continue to meet our legislated requirements of controlling regulated invasive weeds in these shrub beds while using herbicides in a responsible capacity. Next slide, please. Last summer, as a result of budgetary pressures and reduced services due to COVID-19, both regulated and non-regulated weeds proliferated in B-level shrub beds, leading to increasing concerns and complaints from residents. The pictures in the slide above depict the condition of B-level shrub beds in 2016 and 2020, with weeds present. The photo shows a regulated weed, Canada thistle, proliferating in this bed. Taking into account the current condition of B-level shrub beds, administration believes our new integrated pest management approach will ensure that we can better manage regulated weeds in these beds. By employing our new approach this year, the infestation shown in this photo will be eliminated to either allow the bed to return to a more maintained look in the future or to be more easily naturalized where and when appropriate. Next slide, please. When exploring this service adjustment, our main goals were to ensure it continued to comply with all provincial and municipal legislation that governs our work. The City of Edmonton's integrated pest management policy's purpose is to provide a decision-making framework for integrated pest management to protect public health and safety, to preserve ecological sustainability, to promote livability, and to comply with legislative obligations with respect to regulated pests and invasive species. These are the 4 equal pillars within the policy. Prior to this adjustment in service, our teams have focused on manual weed control as our primary control mechanism for weeds in all shrub beds. Due to the reduction in funding, it means that reduced hand pulling alone would no longer be enough to control regulated weeds in these beds, and additional tools are required to maintain these spaces. When crews apply herbicides, we are using a targeted approach, using only federally approved tools and with trained applicators. We apply herbicides only to specific regulated weeds within these beds, not the entire shrub bed or to other weeds in the bed like dandelions. The city's IPM policy also outlines 4 principles: accountability, efficacy, health and safety, and sustainability. We believe this adjustment in service achieves a balanced approach between these 4 principles. Next slide, please. We are accountable to the provincial legislation by ensuring we can continue to control regulated weeds. We are accountable to the public by transparently outlining the products we use, the area it was applied to, and the date and time it was applied, both in our records and online at edmonton.ca/pests. We believe this choice is effective and will follow all best practices with respect to timing and rate of pesticide application as determined according to the federally regulated product label, and ensuring it is appropriate to the site conditions and determined level of pest infestation. We believe in protecting the health and safety of our communities and residents. All pesticide applications will comply with the federally regulated label restrictions developed by Health Canada's Pest Management Regulatory Agency during the registration process. These product labels describe any required conditions of use to protect human health and the environment. Our trained applicators follow the label requirements whenever they apply the material to open spaces. As mentioned before, we apply herbicides only to specific regulated weeds within these shrub beds, not the entire bed or to other types of non-regulated weeds that may be present. It's important to note that the IPM advisory group, made up of 13 citizen members and supported by 3 city employee representatives, reviewed the details of this service change for B-level shrub beds and also concluded they align with the IPM policy C501A. The group noted that the shift from a complaint-driven mechanical response to a routed service for IPM inspections would increase the opportunity for early detection and rapid response for weed control using the appropriate tools and follow-up inspections for efficacy. While we are here discussing an IPM response to controlling regulated weeds and shrub beds, herbicides remain only one tool in our toolbox and often the tool of last resort, being used only where and when it is necessary and will have the desired effect while minimizing risks. It's important to highlight that we also focus on a variety of other tools and methods to control weeds in parks and open spaces, such as enhanced plant health care, fertilizing, overseeding, or planting ground covers, mulching, alternative chemical control methods, things like horticultural vinegar or compost teas. We use insects for biocontrol. We've piloted goats for weed control in our naturalized areas. We use high temperature steam for weed control in our sidewalk cracks. And we have extensive volunteer programs, including our Partners in Parks and weed pulling events. Thanks for your time and attention and for getting into the weeds of our approach this summer. We would now be happy to take any questions you may have.
Great. Well, thank you very much. Always enjoy a good pun. We'll now move on to our speakers on this. First up, we've got Rod Olstad.
Good morning, Councillor Paquette and everybody there. Let me just find my presentation here and I'll start. Okay. I'm compelled today to speak against accepting the weed control reduction in funding report for information. I ask that city staff go back to the drawing board and consider other less invasive means of weed control. Clearly, there's a big emphasis in this report on herbicide use, and I think that needs to be revisited. I also offer a critique of the new integrated pest management policy, which informs and arguably misinforms the report in question. In December of 2019, I applied to be a community member of the IPM advisory group. My application was endorsed by the Canadian Association of Physicians for the Environment, Prevent Cancer Now, and the Edmonton Children's Environmental Health Clinic. I was endorsed to be a health representative to the IPM advisory group. Even though no health representatives or advocates were initially or to this day accepted to sit on the IPM advisory group, my application was rejected. Though I can't say for sure, my educated guess for the reason behind this decision is because my application openly challenges the fundamental assumption of the IPM policy, which is that as long as any pesticide has been duly registered with Health Canada and the Pest Management Regulatory Agency, its use will not be ruled out of hand or rejected out of hand. Instead, non-health related reasons will be used to determine if a pesticide's use can be justified. This is a subtle but significant distinction, which I'll come back to in a minute. There is peer-reviewed science that challenges the decisions of the Pest Management Regulatory Agency. Consider the more than 2,000 peer-reviewed studies about the toxicity of chlorpyrifos, particularly to the neurological development of children. City administration, for many years, chose to overlook these studies in justifying the flagrant use of chlorpyrifos for many years, until our voluntary efforts successfully persuaded the city to stop using it in 2018. In fact, city administration chose to use chlorpyrifos for years, even though chlorpyrifos was only conditionally registered. In the absence of long-delayed health assessment, in the absence of a long-delayed health assessment study. By the way, earlier this month, Health Canada announced that all uses of chlorpyrifos will be banned in 3 years, and that industry never did provide the required health assessment study. There is clear evidence that city administration has prioritized protecting and massaging the public image of the pesticide industry, arguably over protecting public health. During the public consultation process in 2018, that was the process that informed the new IPM policy. Dr. Raquel Farreau, who will be presenting shortly, who was at that public consultation as well, made a perfectly legitimate request, which was to consider ways or consider a use, may use, and do not use listing of pesticides to inform the new IPM policy. Given that city administration had just agreed that the given that the administration had just agreed at the Pesticide Use Audit Committee hearing, that was earlier that year, early 2018, they agreed to more clearly define the least toxic pesticide. Dr. Farreau's request was part and parcel of that commitment, to determining the least toxic pesticides. Arguably, the public consultation process gaslit Dr. Farreau and other members of the public, the city auditor and city council, insisting that such a list was completely impossible. This is simply not true, as evidenced by a number of comprehensive, scientifically informed lists in numerous jurisdictions across Canada. City administration ultimately backtracked on their initial commitment. They clearly, in the audit, they promised, they accepted the notion of accepting or they backtracked on their initial commitment, and they dropped the concept of least toxic, instead focusing or framing the policy in terms of least invasive. This framing is deferential to the pesticide industry, conveniently glossing over the fact that pesticides are indeed toxic. Otherwise, they wouldn't work. Unlike staff in many jurisdictions across Canada, Edmonton staff refused to frame the IPM policy in terms of even entertaining the notion that a pesticide might be deemed unacceptable for use in Edmonton due to peer-reviewed scientific expertise that is contrary to the Pest Management Regulatory Agency.
Rod, I'm so sorry to interrupt you. You're over your time.
Okay.
Okay. So, but there will likely be questions for you from.
I'd be happy to entertain any questions.
Okay, thank you. Christine Kowalczyk, you're next.
Okay, thank you. And I sent in a presentation, a PowerPoint presentation. Should come up. There we go. Thank you. Good morning, members of council. I'm speaking today against administration's proposal to increase pesticide use in our city. The budget adjustment last fall should not be used as an excuse to increase pesticide use, especially when the need for the adjustment in the first place is a pandemic that arose from our destruction of nature. Increasing pesticide use creates more problems than it resolves. Pesticides, as a recent study has shown, harm the vital soil organisms that keep soil healthy. Next slide, please. This means that the report's suggestion that pesticides are proactive in reducing weeds in the future is false. On the contrary, pesticides deplete the soil, thereby creating the conditions for weeds to proliferate. Secondly, depletion of the soil decreases the soil's ability to sequester carbon. Thus, it creates problems for both the biodiversity and climate crises we are facing today. This is anything but sustainable, which the report lists as a guiding value. Pesticide use also increases health risk, the last thing we need in the midst of a pandemic. The report's statement that the spraying will abide by all Health Canada regulations, which protect environmental health and public safety, is misleading, as Health Canada registers products not based on their safety, but rather on a determination of acceptable risk. Next slide, please. This is not the first time the city's IPM group has used misleading language regarding the risks of pesticides. Last year, a member of this group stated in an email that wood dust, sunlight, and salted fish are all rated as more carcinogenic than glyphosate. This is false, dangerous information. Not only has the World Health Organization deemed glyphosate a probable carcinogen, in 2018, a US court awarded Dwayne Johnson $289 million after deeming that his cancer came from using Roundup. Cities are now taking it upon themselves to ban this pesticide, as happened just last month in Laval, Quebec. Next slide, please. Edmonton is potentially risking costly liability in continuing to use chemicals that are now recognized as causing human harm. Over 100 cities across the country have already stepped forward to protect human and environmental health and implemented cosmetic pesticide bans. These cities include Toronto, Ottawa, Montreal, Halifax, and Vancouver. And those cities have not become overrun with weeds. Vancouver, for example, is a beautiful city and its flower beds are far from unkempt. It even has a street garden program. Next slide, please. Not only is Edmonton 25 years behind the rest of the country in protecting human and environmental health from pesticides, this report represents a step back from even our own 2015 policy. That policy suggested that an IPM approach would consider pesticides as only a last resort, and that when chemicals are used, the least toxic chemicals would be chosen first, principles that were reaffirmed as important by the 2017 pesticide audit. This report, on the other hand, directly states it is choosing chemicals first, and it makes no reference to using least toxic chemicals, such as those in the list Health Canada has itself published. It furthermore notes the intention to reduce the pesticide-exempt areas outlined in the 2015 ban. This would take us further backward. There are other ways of accounting for this budget adjustment that do not harm the health of humans and the environment, and indeed create multiple benefits. First, the city could decrease its mowing and increase naturalization, which would furthermore help protect pollinators and decrease the city's carbon emissions from gas mowers, weed eaters, and leaf blowers. Engaging citizens by asking them to send parks operations Google Map pins to areas where they think mowing is unnecessary would help open opportunities for public education and encourage public support for such a shift. And second, shrub beds could be offered to community groups through Partners in Parks, for communities to fill in its perennial food forests, annual food gardens, pollinator gardens, or a combination of these uses. This is the kind of initiative the Edmonton Food Council is apparently already considering through its alternative landscaping models. This move would alleviate the city's costs of shrub bed maintenance altogether, help create community, increase local food security, and support pollinators and biodiversity. This model is proven to work. In Los Angeles, guerrilla gardener Ron Finley became famous for his TED Talk on turning boulevards into vegetable gardens, and that was over 8 years ago. Next slide, please. Both of these solutions would support sustainability and resiliency and align with the city's goals. This report is proof that integrated pesticide management does not work, and that it is time for Edmonton to catch up with the rest of the country and implement a cosmetic pesticide ban. I urge the committee to return this report to administration and to request instead reduced mowing and a plan for communities to take on shrub bed planting and maintenance. I also urge council to consider a cosmetic pesticide ban, as it's clear that's the only way to protect citizens and the environment from unnecessary chemicals. Thank you for considering my perspective on this issue.
Thank you very much. And we will now move to Raquel Farrell.
Thanks.
Dr. Farrell.
Can you hear me?
Yeah, we can.
All right. Thanks a lot, Councillor Paquette. I'm not sure, sort of with this new system, did the clerk send you a copy of my Like, do you guys access the reports? Is the clerk able to send them to you? Am I frozen?
Yeah, I'm just wondering if we get a response from the clerks.
Okay.
Yes,
Well,
all correspondence has been sent through.
Okay.
Okay, I don't know, so can counselors access them? I mean, I don't know how it works. I just thought, you know, you can read as well as I can. But my hope is that when you saw that lovely, I'm a huge fan of Travis Kennedy's and his work, and I think I heard him speaking to a lot of the things that I would like more citizens volunteering and taking on these beds, less beds, because I think they're a kind of antiquated horticultural approach that we're sort of moving from. I think probably when most of us saw those pre and post 2020 beds, there we kind of like the post with the beautiful thistle that so many of our bugs have learned to love long ago. So I think some of this war on weeds is a bit of a colonial war trope, and we need to get rid of it and accept some of our new emerging novel landscapes that are a lovely combination of settler and First Nations, the plants that were originally here. So I have a lot of questions. When like did administration decide to use more pesticides, or did council actually say use more pesticides? I like that part. I'm a little confused on. Would love it if somebody could clarify that for me. But at any rate, I was sad that administration chose to use more herbicides for sure. I mean, it seems that it's clear that they're using a cheapest approach regardless of value creation or value destruction. And I also sort of heard implied in the report that they feel they can do a better job controlling regulated weeds by reducing manual means and increasing herbicide use. And I don't buy it. I mean, my own yard is handled manually, and in my, 30 some year experience maintaining native plant beds, that's kind of the only way to go. I've never seen it done with herbicides. I was surprised when the committee, when council first agreed to the new IPM policy in 2015, we had a partial cosmetic ban that started moving us closer to an approach that honors health and environment. And now the new policy seems to be moving all operational details away from council's purview, freeing administration up to use the blunt tool of herbicides again, and pursuing business as usual. And I just want to remind folks that in 2016, Albertans were surveyed, 1,000 Albertans were surveyed regarding their desire for cosmetic bans that included private property as well as city property. And across the political spectrum, 57 to 77%, depending on their party lines, were in support. So I think we want stronger bans that will better protect human health, not weaker ones. So to me, resorting to more herbicide use on beds is a step in the wrong direction. So in my report that hopefully you can access, that hopefully the clerk has sent to you, I have questions that I would love for council to ask. I don't understand how $1.4 million can be saved. I mean, I understand there's 200 some beds, as Travis said. I don't know how many are level B, but to go in and selectively herbicide just the regulated weeds, leaving all else untouched, seems like it would be super intensive. And I would question that, you got the person there doing that meticulous work. Can we really save 1.4 million? Also, how are we, I felt it was not factual for administration to imply that it's because of the cosmetic ban that there's more weeds in these beds. And I think the problem that we have to realize is the beds themselves. Whenever you disturb soil, you're gonna get aggressive plants coming in to rescue the soil and hold it there. So the problem is the soil disturbance in the first place.
Right.
Um,
Unfortunately, you're over time. I did give you a bit extra because we had the brief conversation at the start.
Sorry, I wasn't looking at my time. I would have shut up long ago. Thank you for cutting me off.
Never want to. We'll move to Elvira Falconer. And while we're waiting for Elvira to log on, I will mention that we did get your email and your question.
Good morning. To all members of City Council, and thank you for letting me speak today. I was really distressed and appalled upon reading the proposed changes to increase or loosen current regulation regarding the city's use of herbicides and pesticides in the city of Edmonton. As a capital city, we should be leading the way in environmental and climate change issues, not consistently speaking from both sides of the mouth and then choosing the path of least resistance or the path that purportedly will save the city a few dollars. Pesticides and herbicides should be ultimately banned, and we demand the city to refrain from their use and replace them with healthy, ecological, long-term alternatives and initiatives. Many countries are moving to ban or have already banned these dangerous chemicals, citing a growing body of evidence to its negative effects on human and non-human health, as well as a long list of other environmental dangers. Has the healthcare cost been taken into consideration in your savings for vulnerable groups, such as our children or your civil workers from occupational exposure? Many of these chemicals kill harmless organisms that are beneficial to the ecosystem, and their application only exacerbates their already threatened existence, many on the verge of becoming extinct or already obliterated. These toxic substances continue to plague us by remaining in the environment for very long periods of time, contaminating our soils and waters. What savings are generated by the significant costs to amend this contamination? It makes much more sense to cut out pesticides and herbicides altogether and focus our money and energy into transitioning to a pesticide-free city. It will require all members of society to make a joint effort, including sports associations and our precious golf courses. Our neighboring cities could be persuaded as well if our politicians and policymakers would just take the lead. There are ample resources of countries already transitioning or having fully integrated pesticide-free cities. They have had good experience with alternative methods of weed management, and they are willing to share with others. Look to Copenhagen and the EU. We should be striving to be leaders with regards to climate change and the environment. We should be protecting and investing in our remaining green spaces through education and stewardship, making it our top priority and reconnecting everyone with the land and sharing in the responsibility of protecting the very biodiversity that sustains all life on Earth. If we learn to honor land, live in reciprocity with land and our non-human inhabitants, then they will in turn look after and provide for us in their own biologically intended ways. I keep hearing, listen to the science, listen to the experts in these times of COVID. Why are we not extending this same courtesy to our environment and do due diligence to the concerns and threats that pesticides and herbicides present to our ecological and physiological well-being? Let's invest in a pesticide-free Edmonton. Thank you.
It looks like my mic was muted. Thank you very much. We'll now move to Nathan Binema.
Mr. Chair, our office was informed that Nathan will no longer be speaking.
Okay. Then we will move to Cheryl McCumsey.
Thank you very much. So I want to say it's unfortunate, but Edmonton is really decades behind the rest of Canada in protecting the public from unnecessary use of pesticides. And spraying herbicide in a bed where you have existing shrubs is bad policy. And let me explain that. Does the city like being fiscally responsible? When you spray near a plant you wish to keep, you risk losing it. That's simple. There are studies showing how herbicide does not just hit its intended target, Actually, the most of the pesticides that we use, about 80 to 90% of it is sort of wasted. In fact, farmers have filed lawsuits in regards to the loss of crops. They have also developed cancer around the same pesticides that Edmonton still uses. Herbicides also do damage the soil and the microbes in the soil. If you don't kill the shrubs you want the first year, you will weaken the immune system of that plant due to the damage you do to the soil. This is science. To support everything I am saying, I can provide that to you. You need enough herbicide to kill the weed. So drift, persistence, and buffer zones means you indeed risk losing everything in those shrubs that you want. So for a long time now, people have been trying to explain things like conflicts of interest, for example, and how pesticides are assessed in the first place. Agrochemical companies test their own products. They aggressively market that product, and now, after 53 years, Health Canada is banning chlorpyrifos because they say the industry has failed to provide the health studies. I have filed an affidavit to see those studies months ago, and the Health Canada has now banned this study. Edmonton used this pesticide long after other municipalities stopped using it. A number of people filed objections to the re-registration of this pesticide, and that's what resulted in the move to be banning it. Yet this was banned in the entire continent of Europe, banned in Saudi Arabia, banned in Malaysia. So the city administration said this pesticide was safe. I have that in writing. It's quite possible that it has harmed citizens of this city, but we won't know that. They were not informed. They did not have informed consent. In New York City, they illustrated how this pesticide banned children, impacted children's nervous system before and after it was used. There are lawsuits going on in Canada today around glyphosate. There are studies showing that batches of 2,4-D are contaminated with dioxins. Both of these pesticides would be used in shrub beds. I'm attending a forum right now, and I can tell you the science on the harm of pesticides are growing. Pesticides kill and hang around much longer than industry tells you. Studies done in Alberta show pesticides persisting in the spring that were sprayed the previous fall, exceeding provincial standards. These pesticides hang around a long time. Another thing to note is that chlorpyrifos, its breakdown products are 10 to 100 times more toxic than chlorpyrifos itself. And glyphosate also breaks down into a harmful product that is being tested and shown to be harmful as well. These things do not magically disappear. So I'm opposed to this. And I think that we could simply look towards using a hoe. A hoe is something you buy once. I use it. I see farmers use it. I think that there's science, evidence, and there's a desire for citizens to see us do something different. We are losing many species. We are suffering ill health because of the toxic soup we live in. We are not winning the war on weeds. Weeds are always going to be there. It's how you design your environment, which will reduce your impact of weeds. It's how you decide to address them. Pesticides really do not work. And they are something that kills. They kill not just weeds. They're designed to kill weeds, but they'll kill the very plants you want to keep in your shrub beds. So why not use a hoe? You buy it once, that's it. I'm hoping that you'll consider that integrated pest management doesn't clearly outline the way you design your environment. So I hope City Council will not accept this proposal and look at something better. Thank you.
And thank you. Next, we have Marcus Wilhelm.
Thank you. Can you hear me?
We can hear you.
Okay, thank you, dear councillors. And I just want to say thank you to those who spoke before me. I don't have much technical information to add to what has already been said. I would like to quote my wife, who is a avid gardener, and she gardens without chemicals has been for 30 some years. and produces wonderful results. She calls weeds plants out of place. But even before she pulls one, or before she allows me to pull one, she will pull out a book and make sure that this is not something useful in our garden. All plants have a purpose, and nature created them and allows them to grow wherever they grow. Some are pioneer plants, like as has been already shared, that will go where nothing else is growing right now. And what we call weeds are usually those kinds of pioneers. We know all about pioneering here in Alberta. We should allow nature to do what we are, as part of nature, also do. Chemical herb killers sprays harm plants, fish, birds, mammals, both wild and domestic, and of course us humans. And I mention us humans last because we are at the top of the food chain, and our health depends on the health of every other part of nature. The producers of weed killer chemicals are profit-driven corporations whose lobbying efforts and advertisements dupe people all over the world to buy their products in order to produce results. They go to court over these things because there are huge financial gains at stake. The producers of these chemicals are the ones who define what is desirable in our cities, in our lawns, on our properties. What is aesthetic is usually defined by those who sell us these products. Let's face it. That manicured lawn, well, it's advertised to us. But look at a meadow, a natural meadow, and you will find much more beauty and much more things to capture our interest. And so I'm totally against the change in policy. I would like to support or suggest alternatives. One of them that I've witnessed is the Goat Herd Project. Witnessed it in Rundle Park a couple of years ago. It was wonderful to see. It was great for plants, animals, and humans. It was wildly entertaining. And secondly, I'd like to propose that the $1.4 million that are supposedly being saved be invested in a program to hire students or other underemployed or unemployed people to do these jobs that supposedly the city has been doing, using a hoe, using whatever, to weed beds where they need to be weeded. It's a very meaningful employment and greatly contributes to the community. So I think it's a win-win situation if we step away from chemicals and towards manual management and naturally integrated weed control. Thank you.
Thank you for that. We'll now move to questions from committee, but I'm not seeing any except for, oh, there we go. Councillor Nichols now on the board.
Thank you, Mr. Chairman, and thank you everyone for your presentations. I'll confine my questions to Ms. Walchuk and Dr. Farrow today, if you don't mind. So let's be clear. Pesticides is a very broad category. Today we are talking herbicides, correct?
Health Canada considers herbicides, fungicides, insecticides, and all other sides under the banner term pesticides.
Yeah, but it's always good to know that what we're talking today. We're talking about beds and we're talking about herbicides today. So I'd like to keep definitions clear, right? Pesticides also refer a whole other classification of other products. So Christine, I just want to talk about herbicides today. I want to draw that for everybody's attention. So, okay, so I will tell you something.
I think that is what we're talking about. Agreed.
Yeah, okay, super. So I'll tell you exactly what I'm hearing from my constituents, all right? Naturalization, they are tired of it. They are tired of the dandelions. They are very frustrated with the way the city is looking. And so what is the medium ground between, as you see in the report, our complaints have gone up not by one-fold, but threefold, maybe fourfold, with regards to how the city is looking, its tidiness, and so on. So how do either of you want to explain to me? I'm going to go back to them and say, what should we be doing next that makes the best sense for both your perspective and their perspective?
I'll try that, Councillor Nicol. First, I have a question on the complaints. I think that I heard in the report that complaints were going up. I don't understand what they are. Are they people that are just wanting more mowing? Are they people specifically saying, I want the city to use more herbicides? Because, I mean, we know that they're in the minority, that the majority of the people, the substantial majority, wants less
So
herbicide.
Dr. Furrow, the result is this. They're tired of the city looking messy, particularly with regards to dandelions. And I'm putting that on the table because we've heard that. The other councillors can speak to that. In Ward
I
11,
have a simple answer to that.
holy crow.
You can tell them that we're more concerned about your health and the environmental health. We're facing a climate crisis and a biodiversity crisis, and aesthetics just have to take a back seat right now. I'm sorry. So I think that it is important, Councillor Nicol, for you to educate your constituents. Yes, that's all I have to say. Thank you very much.
I'll add a few things. One is in the report, the word complaints was used, I think, once, and then after that it was notifications. And so I think there's a little bit of uncertainty there as to the nature of the calls that came in, for one thing. I know I called to say I loved the way the city looked last spring when, there were fields of clover. I remember, somebody posted on Twitter, some kind of statement like, I had no idea that this was an option. I went out for a morning walk this morning and saw a deer, So I think we just have to give it a chance. I do also agree with Dr. Furrow that this is really an issue of public education. And I think, I was surprised, I will say, to learn about this street garden program in Vancouver. I didn't know that existed. I think most people don't know that there are these alternatives. And it's really just, helping people to see what these alternatives are and give them a chance. And when we do, we see, as Mr. Wilhelm said, that, these places are actually really beautiful.
So let's how I think, both of you. I focus on the result, right? The fact is, I'll tell you from my ward, I have dozens into the hundreds of complaints with regards to naturalization and weeds. Now, I don't have to go to this report to tell you this, but we have to focus on a result. Now we're talking about bedding plants today. Is it the question that, I have an issue, for example, I'll speak up right now, that 1.14 million, if that's going to manual weed control, I'll put that money back. I'll move to put that money back. I mean, that's what I see as some of the solutions here, is that we need to move back to some more manual weed control. Does that make sense?
It doesn't make sense, Councillor Nicol. I wouldn't expect most people to understand why it doesn't make sense either. As somebody who's really enjoyed gardening, and I mean, I just want to establish some credibility here. I've been in 5 gardening magazines, including Gardening Life, and so I am a gardening cover girl. The aesthetics, I mean, if that is your priority, and I would suggest it shouldn't be, but if you feel you need to cater to constituents that have an aesthetic that you would like to honor, there are ways to do that, and there are ways to do it cost effectively. It needs to be, you really need to think about the goal you're trying to establish. Maintaining a shrub bed is very, very difficult. That takes a lot of labor. There's exposed and disturbed soil. So that is a very hard task. So if that's the way the city's trying to achieve its aesthetic, that's going to be difficult. So I think it's a very complex goal that you're after, trying to achieve beauty. Beauty is, in the eye of the beholder, as they say. So it's, be careful what you ask for. There's inexpensive ways to achieve beauty. Shrub beds is probably not the way to do it.
I'm out of time.
Okay.
An argument to be had with you, Dr. Furrow.
All right. Councillor Henderson, go ahead.
Well, maybe just really quickly to follow up on that a little bit. I think what you're saying, and I think
we would hear the administration would agree with you that in creating the shrub beds the way we've created them, we probably have not made the wisest choice to begin with in terms of planting in a way that isn't going to create these kind of problems. And I think, Dr. Furrow, that's what you're arguing for, correct? And I think you'll hear Mr. Kennedy agree with you on that. Is that fair to say?
Yeah, I think you're right. I think that likely Travis Kennedy and I are headed in the same direction.
Yeah.
I'm just saying that there's a more direct route and a cheaper route. And
Yeah.
I would also like to say, yeah.
I just to answer, I think to sort of, to just to follow up on Councillor Nichols' question. My other question, so, because I put the motion forward that got us here because I was concerned, and to be clear, this is not a discussion about the cosmetic ban. That's not really part of this. This is about specifically how we deal with our noxious weeds in the shrub bed piece. And we came up with a policy a year or so ago that I thought was going to be applied in a slightly different way, and that's why I wanted to get the report here. So just to get some clarity around that, and maybe I'll go to you, Mr. Olstad, first. I too share your concern that given that public health was part of what we were trying to deal with here, that we have an advisory group of some fairly impressive people, but that does not include a public health specialist. And that seems to me as a gap in applying the policy the way we had anticipated, and I think the way it was pitched to us a couple of years ago. And your concern, I think, and Dr. Furrow is shared in that, correct?
Well, I mean, I was at that, or I attended I watched the hearing of the 2018 pesticide use audit, and I remember you specifically asking the staff and administration to confirm that part of the heart of the core of an effective integrated IPM policy would include pesticide use reduction, and that seems to be completely outside of what's happening here. So I think that administration has really. I'm really concerned the way that administration, they could have paid more attention to I think what was.
Well, and I asked to report because I was puzzled about the alignment, because I wanted to go back alignment between what we were being asked to do, and I think, to be fair, we challenged the administration with coming up with cost saving, and this was the response that they came back with. But back reading through that IPM policy, I don't see cost as one of the factors in there as a lens. And that's what's puzzling me a bit about this. And maybe to explore one other thing with you, because it's, it is my understanding, I don't know if you have information on this, that a lot of the pressure on Health Canada around what's allowed and not allowed is probably coming from the agricultural sector, not from the gardening sector. And obviously agriculture is a much more complicated question here, but it also has different health risks to it. But it really is a one size fits all and one set of rules in terms of what's considered safe and not considered safe, correct?
Well, I mean, I think that certainly what happens in the city of Edmonton, it helps to, it's a public issue, and it informs the public attitudes that are also going to have some influence on what happens to the agricultural community as well. I think the industry sees that, and that's why they're promoting pesticide use. I mean, the whole IPM policy is all about justifying the use of a pesticide. It's not about reducing the use of a pesticide. It's not about whether or not a pesticide should be, there's no consideration of whether or not it just simply shouldn't be used.
I could speak to this because the PMRA registers a pesticide and all its uses. So it doesn't have anything to do with whether it's agriculture or not. They determine each pesticide and all of its uses. That's what this is. Yep. This was to re-register chlorpyrifos for mosquito control.
Yep. No, understood. I don't want to get into I want to be just a little bit careful because we're really just talking about the noxious weed list here. There's a much bigger discussion about pesticides. There's a much bigger conversation about the cosmetic and whether or not we went far enough on our cosmetic ban. But this is about what our tools are in terms of that noxious list that we have some legal responsibility to take care of. And making sure that we have the right set of tools in their place, and that's what the IPM was to do, to make sure that we were doing the least damage and the least harm. Am I right about in your thinking about what we're not achieving here that we need to be able to achieve?
I think that was
maybe. Yeah.
The reason I attended today is because the report implies that by addressing the noxious, the regulated weeds with chemicals, that is a quicker route to eventually not having to use chemicals. It implies that we will use less chemicals if we create further exemptions to the cosmetic ban. It implies that these chemicals are effective and help us preserve biodiversity, and that is not true. So the only way is to be a little smarter, to recognize their roles. Most of this is an agronomic piece of legislation. It is complaint driven. We could take it a lot less seriously. We could educate people not to report it. Many jurisdictions, many municipalities have come to recognize that unless they have a realistic goal, unless they're creating a very small space where they want to revert to a nostalgic landscape, a pre-contact landscape, they really shouldn't even try, because you're going to waste a lot of carbon. You're going to carbon-intensive pesticides, carbon-intensive fertilizers, carbon-intensive two-stroke engines. Trying to maintain a pre-contact landscape is not something achievable in an urban environment. Ecologists are coming to recognize these as novel landscapes, combinations of pre-contact and contact plants. Many of these have been here hundreds of years now, and the bugs, who have generations sometimes as quickly as every few months, have totally adapted. Their proboscis has grown to accommodate those new plants to access the nectar. So it doesn't make sense. And the problem is that we're always kicking down the road, using less herbicides till later. The way we green, it says we want to eventually eliminate them. We're not going to get there from here. We're not on the right trajectory.
Great, thanks. I'm seriously out of time. Thank you.
Yeah, thank you. Councillor Manga, go ahead.
Thank you. Oh, I better turn my video on. Anyway, my question is basically along the same lines as Councillor Nichols. I represent a ward that's half covered by still farmland and acreages, and the other half is, of course, all the development has taken place. And I get the complaints to my office there all the time that their kids, when they try to enjoy the soccer fields and open spaces, it's unsafe because of all the weeds in there and whatnot. And then also people are saying that this looks like a dandelion city. That's what they call in my area. I don't know if how can we control? No manual labor would be able to control that. Any comments on that?
Yeah, just a simple comment that no herbicides are going to control that either. I mean, if they've worked, they would have worked decades ago. I mean, good luck with it. You're just going to spend more money and create a bigger carbon footprint. Not to be disrespectful, but I mean, it's a perfect business plan, but it's an imperfect way of trying to eliminate herbicides. It's a good business plan if you want to sell more herbicides, but it's not actually going to get rid of the dandelions.
No, okay. No, I agree with you. I'm gonna just put you a simple question of, we all have medication sitting in their medicine closets and whatnot. They are again not cure for everything. All they are is if somebody's got fever or whatever, it just eliminates it temporarily. I think this is the same way. For some reason, I think we are more focused on this 1.4 million or 1.14 million than the actual problem that
I can see how you would think that way for sure, Councillor Benga, but I just want to point out that, you know, in medicine, for example, we've been very careful to reduce our use of antibiotics because we create resistance. And that's the same thing that's happening with our exuberance with herbicide use. We're just creating a tougher problem. We're kicking the problem down the road.
I'd like to say as well, Councillor Banga, is that the science around the harm pesticides do to our children has been increasing, and we are seeing a lot of disease in our children and in the general public increasing that's related to the exposure of these pesticides that persist much longer than we thought previously. So it's ignoring that when we talk about that. I used to work in microbiology. If you take an antibiotic needlessly, you can develop a disease called Clostridium difficile that could kill you. So there are impacts of everything we do, and drugs is a good example, a good analogy, because if you take something needlessly without thinking about the consequences, you can make yourself very sick. And so people are getting sick from these exposures. And we do see that. That's why these lawsuits are happening in Canada. There are 4 class action suits around glyphosate in Canada right now.
Okay. Just building on to the proportion of pesticides we spread in the environment here. I mean, basically agriculture, and then what we do from the gardening sector, etc., etc. Can anybody tell me that, you know, I know, of course, we will ask that question from administration. Can anybody from the speakers here tell me that there is a lot more herbicides, pesticides being used in agriculture sector as compared to what the city is using? Any comments, please?
Just that there are a lot more people in the urban environment. So you have a lot more people exposed to the chemicals. And I just, I think to give more room to the others, I'd just like to say I'm disappointed by the focus on aesthetics over health and environmental health. I think, you know, as councillors, it would be helpful if you would give a clear message to the public that you will work to protect their health and the health of Edmonton's environment.
Actually, there are also studies around municipalities that indicate that the toxic load in some urban areas is higher than it is on farms. It depends on what you're comparing. So there are some farms in Alberta, for example, that might, I've heard from other farmers, might use glyphosate, for example, 7 times. But how many times are you spraying in that shrub bed? And those children in that area don't even know that that shrub bed has necessarily been sprayed. It is really hard to do comparisons like that, but we do know that these pesticides impact our children's health. It is clear. There is a growing body of science around that. And so it's really true what Dr. Fro is saying in regards to aesthetics. So it's kind of like we have to decide what our value system is based on. Is it based on our ability to consider having a different landscape that we've been kind of conditioned to? Or can we recondition ourselves to a new environment that is going to be far less harmful, far less toxic? And because we know these pesticides persist a lot longer than we previously thought.
Thank you. I think I took time and a half what I was supposed to. Thank you.
A little bit. In fact, we are bumping up against 12 o'clock, and I have some questions. I see Councillor Nichols on the board again, but that may just be to put a recommendation forward. But
And for administration, questions for admin. So
you have questions for administration. So I'm wondering, we've got two options. We can extend to get through questions for speakers, or we can ask our speakers to return after our 1:30 item this afternoon.
I'll move that we extend so that you can finish questions of speakers so that they can go on about their day.
Very
do we
much.
not have a 12:30 today?
We do, and
we do have a 12.
I'm not going to support. Yeah, I'm not going to support extension. But that's okay. Just a one vote.
So let's just do it later on this afternoon. I agree.
Speakers,
So
apologies. We have an item at 1:30 that may take some time. So if you are willing and able to come back in the afternoon, there are definitely some more questions for you from committee. But at this point, it sounds like we're going to adjourn.
Do you have an estimate of when in the
Or
afternoon?
just break for lunch, actually. What's that?
Do you have an estimate of when we might be back?
I'll take a quick look. All estimates, I can tell you, are going to be very, very rough. It looks like if we have a 1:30, we can count on it being at least an hour. Another
after 1:30?
Another councillor can contradict that, or the clerks, but that would be my estimate.
So that means an hour after 1:30, like tune in at
Yeah,
2:30
so-
onwards.
Yeah, like so it's somewhere between 2:15 to 2:45 is probably when we would get return to the item.
Thank you very much.
Thank you.
Okay, and with that in mind, we will now break for lunch. Okay. As limited as it is for us.
Good afternoon. Just letting everyone on the meet know that we are turning on the live stream. Thank you.
Hello and welcome back. We'll do a roll call right away. Just give everyone a few more seconds to get settled. Okay, and welcome back. I'll just do a quick roll call. We've got, I see Councillor Knack is here. Good afternoon.
Good afternoon.
We've also got Councillor Zadek. There you are.
Good afternoon.
And I see Councillor Nickel.
Yes, sir. Good afternoon.
And to you. And joining us as well, we've got Councillor Henderson.
Afternoon.
Afternoon. And just want to make sure I'm not missing anyone. I think that's it. Okay. At this point, we still had some questions. Oh, actually, no, sorry. We're moving now to our next item, item 6.2, Lewis Farms Recreation Center. And I believe that there's a presentation from administration, and we will hear from speakers.
Thank you, Mr. Chair. We do have a short verbal presentation. I'm here with Roger Jevany. Roger is our branch manager of community and recreation facilities. We also have staff on this call from Citizen Services, from Urban Planning and Economy, from IIS, and also from Legal Services. So in February of this year, this committee, Community and Public Services, directed us in the administration to work with Active Communities Alberta and the Rosenthal Community League to determine how a proposed multi-sport outdoor recreation facility could be developed on the Lewis Farm site. As we indicate in our report, administration recognizes the project does have merit for further consideration. So I'll pass the presentation over to Roger to briefly present the results of the work we've done to date and information about the next steps for this particular project. So over to you, Roger.
Thanks, Rob. So administration has met with Active Communities Alberta and the Rosenthal Community League to gather more information about this proposal and to discuss locating the proposed facility on either the Lewis Farms District Park site or on the nearby Rosenthal School and Community Park site. Considerations for each site were provided, along with an overview of the community-led construction project to move this potential project forward. Both the Lewis Farm site and the Rosenthal School and Park site have challenges and opportunities, and administration is working with the proponents to initiate the project proposal. Administration understands that a business case for the project, including the proposed operating model, is being developed, focused on the Rosenthal School and Community Park site. Once the business case is complete, the proponents and administration will have a better understanding of the project, the proposed capital and operating budgets, and funding sources. The results of the public engagement on the project and a more detailed review of the proposed location and operating model will also be complete.
If all goes well, the project would move into the concept phase where the proponents would have the support of the Integrated Infrastructure Services team to move the project through design and onto construction. So thank you, and we would be pleased to answer any questions you have following the speakers today.
Okay, thank you very much. And we've got Paul Andrews first on the dock. You have 5 minutes, Paul.
Thank you and good afternoon. I'm here today as the president of the Rosenthal Community League to confirm our support for this project. Community of Rosenthal is situated in the southwestern boundary of Ward 1 with population based on the 2019 census of 3,650 residents. Our community is also the location of the proposed Lewis Farms Recreation Center, which, as many of you know, has been approved but delayed due to lack of funding. As such, West Edmonton is one of the few areas of the city that does not have a city-funded recreation facility. This leaves many residents of West Edmonton unable to access programming, attend city-funded facilities, or having to travel far distances, including to other cities like Spruce Grove and St. Albert. While this project will not replace the need for the Lewis Farms Rec Center, it will provide a significant benefit to the community and neighboring communities and allow for community-led programming to be offered year-round, rain, shine, or snow. Throughout this pandemic, people have been looking for new ways to get outside and enjoy outdoors in a safe manner. The one challenge we face is weather, and as we have a significant impact on our programming. In Rosenthal, we offered a small outdoor community rink for community members, which was heavily used, but unfortunately, the weather resulted in a shortened season. So as we move towards getting back to normal, reconnecting with community will be key to recovery and can be achieved through increased recreational activities. A facility of this scope would provide year-round outdoor recreation and would extend the season of many outdoor activities like skating and hockey with its refrigerated and covered surfaces. In addition, programming offered in the spring, summer, and fall would not be impacted by weather. When the Community League was approached by Active Communities Alberta about partnering on this project, we all agreed that it fell in line with our league's vision, that Rosenthal is a vibrant and inclusive community where members engage in social and recreational activities to build a strong connections and safe neighborhood and an active community. Where we are today, the Community League and Active Communities have submitted a one-page document to Community Services about 4 weeks ago. We're currently waiting on the response to that. The response to that document will determine which business plan document we have to submit. Knowing the scope of this project, we have stated that it would be an extensive project, and we have prepared our business case for that. The business case has been submitted to our neighborhood resource coordinator. Unfortunately, until that one-page document is reviewed, the business case cannot move forward. So we're looking for some assistance in moving that forward so that we can move forward with this project. And I thank and yield the rest of my time.
Thank you very much. We will now move to Matt Bakowicz. If I'm pronouncing that wrong, please correct me.
Oh, that's correct. Thank you. I believe, is there Alice Cameron on the call here? Because I believe we'd asked for her to speak first, if that's okay, Councillor?
That's fine with me.
Okay, thank you.
Go ahead, Alice. You've got 5 minutes.
Hi, thank you for having me today. I have a video to be played. It's been sent to the city. Your office is going to play it. Is just wondering if you could play that now, please.
We're putting it up right now.
Thank you.
So thank you for that. Okay, so now Matt, take it away.
Thank you, Councillor Paquette. Appreciate the opportunity to speak here today. I do have a presentation, and if it's okay if I share my screen, I will pop that up and just emphasize a few things here today. So again, just bear with me for a second. There we go.
I will warn you, if there's no music, it will be a little bit less engaging.
Yeah, I'm sorry. I didn't attach music. Unfortunately, you're going to have to listen to me speak instead of the dancing music. So I trust that you can see the screen. The slideshow presentation, is that correct?
We can.
Okay, excellent. So appreciate the opportunity to speak, and certainly here to talk about the outdoor recreation facility. The video provided a good overview of what the vision is, so I'm not going to talk too much about that, but maybe a bit of background and some stakeholder engagement, etc. So number one is that this is a joint project between our organizations, specifically Active Communities Alberta. We are a nonprofit society. We are composed entirely of volunteers, and we really believe in this nonprofit approach to recreation. So it's a bit of a different model than is typically done for recreation facilities around Edmonton, and it's been very successful in other parts of the province and the country, and certainly we feel there's an opportunity to do more of that here in Edmonton. We want to emphasize as well that this is not a replacement for the Lewis Farms Recreation Center. We recognize that that need exists, and secondly, we had talked about that initially as a potential site. However, through discussions with administration and with their input, we've determined that our preference is this Rosenthal Park site, and we will talk a little bit more about that in a second. The key is that this is a unique amenity. None of these exist in the entire region, and certainly we think there's an opportunity for this to be the first of many of these facilities around the city. So again, we're trying to kickstart that at Rosenthal here. Maybe just a bit more in terms of the context and introduction. The video touched on it, that we do recognize that as a society, we're coming out of a challenging time with COVID, and not just in terms of the restrictions and what that's meant in terms of people's activity levels, but certainly it's going to impact the affordability that people are able to take on for activities. And frankly, an outdoor recreation facility like this can offer opportunities for programming that's way more cost effective for families, and in fact, much of it free. So we think there's a real opportunity with that as our society comes out of the COVID situation. Stakeholder support, when the initial motion was made, it mentioned for reach outs to these organizations, and certainly with Rosenthal, we've got a strong partnership. Hockey Alberta and Hockey Edmonton have both provided substantial letters of support and are very eager and excited about this project and how the facility can meet the needs of some of their programming and possibly allow them to do some other creative programming. One comment Hockey Edmonton had as well is that the Collingwood Arena is Collingwood is expected to be down for a period of time upcoming. So this could potentially serve as a overflow, or as an alternative with the closure of that rink for maintenance activities. So again, wanted to point that out as a comment that we received. The vision, we've talked about the vision. Again, it is very comparable to what you normally skate on indoors, but it doesn't have walls. The activities, it's a long list. I think the key here is we actually recognize there are more summer activities that could take place at this facility. So again, it's not a outdoor rink, it's an outdoor recreation facility because it is a year-round facility. The arena strategy identified the Lewis Farms Arena in 2007, and so this area of the city has been waiting patiently for this strategy to be carried out, and certainly we recognize there's some time before a facility of that magnitude can be constructed and open. So again, this is an opportunity as a complementary facility in the same region that could help to address some community needs. Greenwood Park facility, again, this is an overhead shot. It's a covered rink in Toronto. You saw a video of it. Embedded in a residential area, very highly utilized and used by both user groups and the general public quite extensively. Some other pictures which you've already seen. Again, Zamboni outdoors, resurfacing the ice, very high quality ice surface. There's a skating trail and yeah, some other pictures of the fact that it becomes a community hub. And just this view I thought was very important because it shows that it doesn't have that huge of a imprint on the general area. It actually fits in quite well. So this is the covered outdoor rink there that they have. So again, opportunity there without messing around with the surrounding area from a visibility perspective. Preliminary outline, again, lobby area for changing and
I may have to stop you there. I think you're
okay. Excellent. That's all I wanted to say. So thank you for the opportunity.
okay. Well, thank you for that. I didn't want to interrupt, but it didn't sound like there was an end in sight. So we will go now to questions, and I see that we've also been joined by Councillor Hamilton, Councillor Cartmel, and Councillor Banga. So questions for our speakers, and this was selected by Councillor Nichols, so I'll just check in first.
I'll defer to Councillor Knack, who no doubt would like to ask a few inquiries.
Okay, sounds good. Go ahead, Councillor Knack.
Thank you very much. Thanks, Councillor Nicol. Thank you for your presentations today. Just a few quick questions. Most of my questions are going to be for administration because we've obviously talked about this quite a bit. One question that I know isn't necessarily meant to be solved today, but I do think it's going to come up, and so I thought we'll just cover it right now. When it comes to funding for something like this, my understanding is the goal, the intent that you're trying to go through is to fundraise to fund the construction of this. And ideally the city contribution, I'm using air quotes, but the contribution is for us to service the park site like we would at any other park site, but maybe have to do that earlier than we might normally do. Is that correct? Is that the goal?
Sorry, Councillor, that's a question for myself.
Yeah, let's turn to you since, yeah, I know, I mean, both you and Mr. Andrews, but I'll turn it to you for this because I know you're doing a lot of the work on this fundraising component. So
certainly. So we have a complete fundraising strategy built out, and it does call for us to do a variety of fundraising efforts through the community and through other levels of government. Our focus is on raising those funds as best we can to enable this facility to be constructed.
Great. And so there's a few things that still need to happen. So we need to get a sign off of the school board. And I'm going to go through this administration, but sign off of the school board that they'd be okay with that. There is a outdated, or I'm using the word outdated city policy that seems to say covered structures aren't permitted in community spaces. We'll talk about that. Assuming we tackle those things properly, how do you envision in terms of the construction of it? I know we're getting ready to turn this over to our project manager internally, but the hope of Active Communities is to sort of lead a lot of this work directly, correct? So to be able to use the project manager sort of a liaison, but for Active Communities to actually be the sort of dominant party in this of advancing this. Is that correct?
That's correct. We have extensive experience within our board, and also the Rosenthal Community League has a lot of experience in projects of this magnitude. So collectively, yes.
Okay.
And I would just add that the business case that was submitted, we did turn that around collectively within 1 week. So again, we move fast, and we're very aggressive with getting this going as soon as possible.
Yeah, so we do need that review from the city side finished. I'm going to ask about that just to find out where that's at to make sure that because I know that you're ready to go. So let's assume that gets signed off on right away. there's a number of things that can happen concurrently. So that is verifying the school board's okay with it, doing some of this other work. On the fundraising piece, you said you have that fundraising plan. At what point would you have a more clear indication as to when you've got the funds necessary on your end? I don't think we need to wait on that, but obviously before you formally start building anything, we would need to have that. And there's other things that can happen at the same time, but obviously that's a piece that could potentially hold us up. I know you have a sense of urgency of wanting to move forward with it. Obviously, the Rosenthal Community League has a massive sense of urgency along with many surrounding communities. But can you just walk me through how that timeline works when you would hope to have that resolved?
So the sense of urgency also comes from the community and many of the user groups that we've spoken to as well, to emphasize that. From a fundraising perspective, having the land nailed down really acts as accelerant on our fundraising efforts. So having a site confirmed is our key objective at this point in time. Construction of this facility would take about 4 months' time from start to finish. We're working with an architect, and I think fundraising wise, we could have funds in place for this fall at the earliest. And obviously, the sooner we find out about land, the sooner we can get moving on our aggressive fundraising activities.
Yeah. So and just so I understand that piece and make sure I've fully understand it, what you need is confirmation from both the city that we would be okay with you using that land, that is an acceptable site for this, so that you have a piece of land to point to when you're fundraising. And then, of course, we need the school board to sign off on this. That's but that's what you need for that certainty, so that you can go out and raise money from the partners that you're working with.
Correct, and those can both happen concurrently, as you mentioned earlier. Thank you.
I think those are all my questions. I've talked to all of you a long time on this, so thank you very much. I have a lot for administration now.
Okay, thank you. I'm actually not seeing any other questions for our speakers. So at this point, we will turn to questions for administration. And again, I'll just check in with Councillor Nicol.
No, Andrew's going to ask the two basic questions.
Okay.
We just need some targets here, I think Andrew's going to ask for. So.
All right. Go ahead, Councillor Nick.
Thank you. Yeah, sorry, I can't click back onto the screen there. So in fact, that means I also can't get to my list of questions. Here we are. Let's ask the first quick one, since it was raised by Mr. Andrews, around the business case that's been submitted and the timeline for when they can expect that review to be complete.
Yeah, Councillor, we're in the process of looking at it, and we'll certainly keep our feet to the fire and circle back with active communities and the Rosenthal group as quick as we can here.
And just, I mean, so they have a bit of a sense of timing. Are we talking about like next couple of weeks? Are we talking a month? Or I imagine they want to start their planning for the next phase of work too.
Chantel or others on the call, I'm not sure the timing on that, how long that's going to take.
Yeah, the review is scheduled for next week, so it would be probably a week after that we would have.
Perfect. Wonderful. Thank you. That's helpful. So I want to cover a few of these questions. So let's talk about the land. From a city perspective, do we have is the only reason we would have any concern with the land that's being asked for based on what the school board would say? Is that our primary piece that we can think of?
I'll start off, Councillor, and then others can weigh in. I think the school board piece is one. The sort of fit of this kind of facility on this size and type of park, we have to work that piece out as well. But if there's others on the call from urban planning, would they weigh in on that one?
Oh, I'm happy to do that, Rob. Sorry, just finding my camera button. Yeah, I agree with you. I think exactly what you're saying. We need to evaluate not just this particular site, but the network of open space across the community as well, and make sure that all of the considerations for that community are being met.
Okay. Can you maybe I don't want to spend a lot of time on each, but I'll probably need a second round anyway. So can you expand a little bit on that? Because, I think this is a site that is identified for recreation. There's been a lot of work around our master plans already. So I guess I want to get a sense of what does that entail from our end? Is that a long process, or since I think we've done a lot of the work over the last decade, is it more of a quick review to say, oh yeah, well, this aligns with what we were already planning for?
So I can take some of that, and hopefully the folks in Roger's shop can maybe back up some of this as well. Yeah, I think that's something that we can do the evaluation relatively quickly. We need to identify, I guess, what are the considerations, and there can be all kinds for sure. And I know that the school has already been brought up, so that's certainly something that would need to be evaluated and confirmed, as well as things just like traffic and parking and that sort of thing for this level of activity, for
Perfect.
example.
So that does lead a little bit into the policy piece in the report that talks about that we wouldn't typically have a parking structure or a covered structure in a site like this. So I do want to ask, especially considering our recent change to our zoning bylaw around things like parking, I would hope we're not going to lose a lot of sleep over that. If the communities have done the engagement, which they have, and they know that this could potentially generate parking, I would hope we're not going to use parking as a reason why we wouldn't want to advance something like this. Is that correct?
That's correct. Yep.
Okay. So
Yes,
then
I do think we do want to look at the overall site and understand the operating model and what the parking impacts are. And also because this would be on land, we would have to lease back to Communities Alberta where the sports fields would have been. So a better understanding of what the plans are for the community league license site. Because if it's still proceeded with the community hall and other amenities on that site, we just want to make sure that the site can accommodate the parking and we don't have some unintended consequence of parking spilling to the neighborhood without us having advised the community that that's a risk.
How does and sorry to dwell on this one then, though, but we don't have parking minimums for anything else in the city or parking requirement. We have an open parking system now. So if the community is on board and if they understand there's a potential for spillover, what are we looking for in parking then? I'm not sure I understand that. If we don't require that of any other development, why would we suddenly require it of this particular one? I mean, there's going to be some, of course. I just want to make sure that just the answers I've heard made it sound like we're almost putting a lot of weight into something we don't actually put any weight into for any other developments now.
I think, Councillor Knack, the bigger concern is just looking at the plan for programming that would have been in place and understanding what the trade-offs are. Yeah, I think it just needs to be evaluated further.
Okay. I do have more questions when I'm out of time, and Councillor Nicol has some, and I'll probably come back after.
Okay, sounds good. Go ahead, Councillor Nicol.
Well, I think you know where I'm going to go is like, how long is this going to take? The community wants to know because they want to start raising some dough. I don't know who wants to answer it, but is this a 6-month process, 3-month process, this sort of thing? They want to get going in the fall. So how long is the review with all these other things? You've thrown lots of process. That's fantastic. So what is the timeline to if this is a good project to greenlight it?
This is Chantal. Don't want to put you on the spot here, but can you maybe give your best efforts in terms of forecasting timelines?
Sure. The review portion of it is actually quite quick with our new process. It's the funding availability that will be the biggest determinant of when we can proceed. So
Okay,
depending on how the fundraising goes.
So this is what I'm hearing. Within a month, you're going to have it reviewed, right? And it's going to be like, hey, the city says this has wheels, but then we are going to talk about the money. Is that how I can understand this?
And there's that's correct, Councillor. And there's two pieces to the money. There is the actual development of the actual building itself, the roof infrastructure and the artificial ice. And then there's also, as Councillor Knack indicated, the city responsibility for some of the surfacing perhaps. And if that then becomes a requirement, that would have to go to supplementary capital like in the fall.
Yep. Rob, let's not even go there. Let's just get to the point, the first step. I think Councillor Knack would agree with me. Let's just get to the first step and saying, yeah, this is doable. This is yes, we can do that. Then Councillor Knack can move to the next stage, or someone can move to the next stage as to how do we put the deal together. That makes sense?
Yeah,
yes, that's the process. Yeah.
Okay, thank you. That's all my questions.
All right, thank you. Councillor Knack, go ahead.
Thank you again, Mr. Chair. So first, and I know we're not supposed to use the chat, but I saw Mr. Andrews post in the chat. You can text me if you need anything, Paul. I'll ask that question on your behalf there. But I will ask his question since it is in the chat, which is that is the review that we're talking about the one-page document or the actual business case that's been submitted?
It's the one pager followed by the full business case.
So walk me through after the one page is done in 2 weeks. What does that look like for the full business case? Since I think they're ready.
Yeah, with the full business case, we take a look at it through the infrastructure services group as well, and they assign a project manager.
Okay, but that's where we're concurrently going to the school board and checking on them, where we're concurrently doing our work as a verification that this makes sense on that site. So we're not sort of held up at that point. We're able to, as soon as you've done that, do all of these other steps. Is that correct?
We can make it happen concurrently, yes.
Okay.
And Council, there are folks from IIS on the call as well.
Yeah.
Jesse, you can jump in if you're on the call.
Right, yeah. We would be doing it concurrently. So once we get the business case, we would be reviewing it alongside.
Okay. So a few process questions. This process includes circulation to the school board. We don't need to do a motion asking for that to happen. You don't need a motion from council saying we are okay with this. That we'll just go and verify with them that they're okay with it. Is that correct? I don't need a motion on that part.
Yeah, anybody else can respond to that question? I'm not thinking so, Councillor.
I don't think so either. I just want to confirm because I will make it if it needs to be me. But if nobody needs it, if that's part of this next process with IIS, then I'm good to go on that.
Well, I'm trying to think this through a little bit, Councillor. You know, a motion wouldn't harm the going forward. It would just give us that much more of an impetus to move forward. So perhaps leaning on the side of caution. You know,
okay. So that would likely be a recommendation from committee to council to ask the school board their perspective on the use of that parcel of land, I imagine.
I think that would make sense.
Okay. Okay, I might do that. I didn't have that final wording, but I will also help maybe rely a little on the clerks on that piece. The one part I thought we would need a motion, just to be clear, is related to the current policy that states the covered structures are not permitted. Do we need to, it would feel wise in my mind to ask for an exemption to that policy and then maybe more broadly look to review that policy at a later time overall. But I want to make sure do you need direction so that we can essentially say, and that gives, I think, some assurance to the parties who are involved that they can go ahead and start fundraising because we're okay with it. We're going to do the exemption to this policy for this particular site, assuming the other requirements are met.
Lindsay, can you jump in on that one?
Yeah, I was about to. Thanks, Rob. The regulation you're talking about, Councillor Knack, is actually a guideline. So it is something that's typically been our practice, but certainly if we have the supporting business case and you know, other conditions that might need to be met are met, then that isn't a requirement or a policy per se. So I don't foresee there needing to be any motion to address that specifically.
Even better when we don't have to make motions for that. Okay, we've said it out loud as a guideline. I know that we're working with that. Thank you. So, okay. Then I think the other question that I have, we were chatting about funding here. So maybe the next piece is just getting an idea of what kind of work we need to do on our end to service a site like this. What kind? Because you know, we've heard from the proponents here in the community that if they raise the money, they could go and do this in 4 months. But what kind of timeline do we need, assuming there's money in place to do work that we would typically do for a park site? What's the timeline for that kind of work?
Is that in your wheelhouse, Jesse?
Sorry, I missed the question.
I was just wondering the timeline to prep a site like that so that it can be built on, and that, from my understanding, we do that anyways. It's just sometimes it's based on different timing. So
to bring the services
So bring in the services, so the utilities, and it depends on how far we want to develop that site. So right now it would be an open field. So are we wanting to sod, seed, level? How far do we want to bring the services? If it's where the Lewis rec facility would be, do we bring in the utilities for that as well, or just for this rink? How far do we want to go? So we would need to know how far or how much that we need to take in, and whether we're capping off. For the duration of something like that, we need to the drawings for the Lewis Farms utility portions ready to go, or we're getting close to that stage. So we go for tender, and that work could probably happen in the next season going through. But for this specific facility, we'd have to go through the development and design work to see how it interconnects and how it will come together. So
I think the councillor was referring to servicing the district or the neighborhood park site. That's the current preferred site of the group.
I'll come back another time, so I'll come back and just close the loop on that, because yeah, we're talking about the different, not the Lewis Farms rec site, so I just want to make sure. But I'll come back since Councillor Banga's on the list.
Yeah, thank you, Councillor Knapp. Go ahead, Councillor Banga.
Thank you. Heard from speakers that this is not a replacement for Lewis Farms facility. This is, I guess, complementary to it. What do you think it does to the progress so far made on the Lewis Farms recreation center?
It's a good question, Councillor. Certainly the level of service. I mean, if we are able to fund that new rec center that has the rinks in it, and then not too far away would be these additional 2 pads of ice. I think looking at holistically in the entire West End or the entire city even, the number of sheets we'd have would be, and is there enough demand to justify all those sheets? So it certainly is an impact we'd have to think through some more. But again, timing of this is still, I mean, this is very much front of mind that can hopefully, get traction in the very, very near future. Lewis Farms, as council well knows, is, to be determined. So, playing those two things out a little bit. And then from what I understand of this project, all the other uses that can be made of this site or of this facility, are significant as well. So from an ice perspective, there may be almost an oversupply in the West End. But we'll have to drill into that somewhat. Roger, do you want to jump in on that?
No, good answer, Rob. We will have 2 twin arenas in close proximity, but that part of the city continues to grow, and the demand for ice continues to grow. So it would be, something we'd have to factor in as we look at the business case to ensure the long-term sustainability. That when Lewis Farms opened, that it didn't take the revenue-generating piece out of this project, and have any kind of negative impacts on the operations. But
so once this, let's say, the community league and partners, they end up doing fundraising, and then it's all done, and the ultimate responsibility is for the city to run it, isn't it? Or do we don't know?
The operating piece of this? I mean, that would have to get worked out in the business case, and I think it is. This would be a community-run facility with their partners. Would be sort of their responsibility to do the operations, and we'd obviously want to, because the city does run a number of other rinks, coordinate how that works. So again, there'll have to be some work on that question to get a stronger answer.
Okay. And as far as, mention of all these sports, pickleball, hockey, skating, outdoor gym, all the stuff, that has to be determined, see if it's actually possible to do all those activities and what goes where and when.
Yeah, because the group would need to work out the details of what lines they would want to put onto the concrete pads, and then how they would program those in the future. But that would be up to the organization then to decide, if they want to have pickleball for certain hours and basketball for other hours. But they would work with the community league and obviously based on local demand, figure out how to program it in the best way they could.
Okay. All right. Okay. Thanks.
Thank you, Councillor Banga. And back to Councillor Knack.
Thanks. I'll try to wrap up here. Recognize we've got other things on our agenda. So I think in my mind, there's two pieces here. It sounds like we're almost ready to move into the next phase of the business plan. That's going to get transferred over. We can start doing a bunch of things concurrently. My worry is it just gets sort of lost. And so I'm wondering if it's just simply a motion that gives us a status report of this in 3 months' time to update us as to all the work that's been finished and where we're at. Because if there is, it seems like all the parties have a sense of urgency to move forward on this. And since this is wanting to be led by the community, that might be the right approach. Does that seem reasonable, just to be able to do a bit of it doesn't even have to be a written, it can be frankly a verbal report that we come and talk to just to make sure we're all on the same page, and if there's any additional steps that need to be made at that time.
Council, that sounds absolutely reasonable. I mean, certainly, as you set those direction, we can come back and with the community and the partner to give the committee an update.
Councillor, we will need to check in with the Joint Use Committee. This is MR land, so council would need to remove that designation to the land, and that would need some engagement with the school boards and maybe a broader community consultation. So we could look to start that work, or at least map that out really clearly, so we knew that the kind of timing on that work as we came back in with an update in 3 months. Okay, because and maybe even just being able to sit down and confirm that, because for example, I know the community's done some really extensive engagement already to get to this point. Essentially, they're well ahead of the curve, I think, compared to where we would normally expect. So I'd hate for us to be redoing engagement that's already been done. So that might be why, if there's a status report, gives us a chance to advance this next step, get moving, and that can also give us a chance to check in on the funding question, which I know is an outstanding piece and needs to be brought forward back by active communities, but that also is important for us to then advance the servicing piece.
No, that makes good sense, Councillor.
Okay, then the only other question is whether within that motion I should also then specify, I can check in with the clerks, I didn't get a chance to follow up with them, if there's any specific wording for the exemption to that policy or that guideline, just to make it clear that that's the site we're talking about.
Lindsay, do you think that needs to be in the motion, Lindsay, or if it's a guideline?
I think we understand where we need to look, how we need to consider this project, and we understand that some of the guidelines we have from 2006 aren't necessarily the most up to date and don't incorporate new technologies or trends in recreation, for example. And so that is something that's on our radar. We're aware of it. We don't need a motion, I don't believe, but if it makes council or councillors more comfortable to have one, then for sure that can be done.
I did see the clerks turn on the camera, so I don't know if they have anything to add.
I would just add that if it's an administrative guideline, that we wouldn't necessarily pass an exemption, but perhaps just give some clear direction to administration.
I'm feeling confident, but I think it's worth stating that. Okay, so I think it would be maybe a simple, I don't know if there's any wording that's been drafted yet for that, but I would say at a minimum just that we have provide a status report for the proposed all-season outdoor recreation space in Rosenthal, and that was on August 25th. I think is 3 months, just yeah. And it can be verbal. It really does, like, truly, we don't need to have it in writing. I'm fine with that, just to save everyone time. I want to make sure that we're going, and it's just a check-in point. And if there needs to be any motions at that point, we can make them then. But my worry is that we just lose it if we don't have another check-in point. So I'll make that, and then recognizing that we've heard that there's the other pieces I don't think need to be in the motion directly.
So Councillor Knack, we do have wording for the status report, but I'm still working on the wording regarding the guideline.
So I'll just check in to see if there are any other questions from committee or council members. And I'm not seeing any. Just to check in with the clerks about how long do you need for the wording?
I will need just a few minutes. I need some details on it, as well as an understanding if this would need to go up to council.
Servicing component specifically related to this particular site and how that process usually goes. Or Mr. Lockman, who's signed in as well. I see the camera's on. So I want to understand what we need to do from our end. Is there anything you need in a motion to allow this to be planned out so that we're at that point?
Thanks, Councillor. And in fairness to Mr. Banford, he's well prepared to speak about Lewis Farms, not about Rosenthal. So in fairness to him.
No worries.
So I think, honestly, we haven't assessed the servicing requirements because this is still at the one-page assessment. But as part of this motion, we can do some assessments to determine what would be required at this point in time, because it would be utility-based, to provide a timeline related to what the servicing, how quickly the servicing could be done is premature because we don't actually have that information in hand. And I think that's something that, as Ms. Shannon has identified, Chantil has identified, that some of our folks would be reviewing the business case. Once it's developed, we can do concurrently with that.
Perfect. And the good news is the business case is developed, so it's a matter of as soon as we start that process, you would be working on that with your team, and that would be part of our any status reports, the work that you've done on that to assess that site so that it's ready to go.
Yeah, we could do that concurrently with that.
Perfect. Yeah. So I'll just ask out loud, so I'll make sure. Is there anything that can't be done concurrently on this while we're moving into the business case? My understanding is that's sort of how this business case process works. We go and do all of these different bodies of work from the groups that are responsible for each area. Is that correct?
Nothing is jumping out of me, Councillor. I think we can line up all of those pieces to all get in action together at the same time. The dependence, does one have to get totally completed before the next step has to get launched? I mean, I'm not seeing how there'd be a disconnect. So I'm certainly getting the messaging, Councillor, that we want to move. We want to move this forward absolutely as fast as we possibly can. So I mean, I think everybody's hearing that loud and clear. So we'll certainly go in that direction for sure. Do you want to jump in, Adam?
Yeah, I was just going to say, Councillor, that how this is funded is probably the one that,
of course,
has to be figured out, and that's going to be a fall discussion, I'm assuming, just depending on.
And in order to get that, you need to go through this business case to finalize those details. So it's absolutely, I recognize funding sort of the last approval point of that. But in order to help determine what that is, we need to finish this other work, correct?
Right, but even the proposed partnership in terms of what that funding looks like from a city community perspective, I think that needs to be confirmed in terms of council direction, comfort.
Yeah, understandable. Yeah, it obviously, if for some reason they came forward and needed money independent of the park setup, that's a separate conversation. And both still require council authorization in either scenario, but one where we're just spending money on something that we would have normally done anyways is very different than being asked for additional money on top of that. So I appreciate that. That would be a separate conversation point. Okay.
Correct, other than also, you know, not necessarily a pot of money sitting waiting for this, so with priorities and understanding the pressures of those priorities as well.
Understandable. Yeah, would this somehow be jumping the queue of other park sites? And so that's a fair question. Yeah.
Correct.
Okay, I think that's it. And I think that gave everyone enough time. So here it is. The Community and Public Services Committee recommends to City Council that administration engage with the Edmonton Public School Board regarding the use of the Rosenthal School Community Park site for proposed outdoor recreation facility as outlined in the May 28th, 2021 Citizen Services Report. And I think it sort of goes without saying, but it'd be a status report on all of the rest of the work when this report comes back on August 25th.
All right.
So I will move that.
Okay, any discussion?
Sorry, Councillor Knack, just to clarify, because we had a few different versions of wording. So there was one for a status report and then for the exemption to the urban park management plan. And then did you want to do one regarding the school board as well? We can move all three together if that's preferable.
Yeah. Let's do that. I'll just read them all up when I see them just to make sure. So we've read in the first part. I think the second is that Community and Public Services Committee recommend to council. I think that's the one on the screen here too, that an exemption to the urban park management plan guideline on covered facilities be granted to allow a potential development of Rosenthal Park site. And then thirdly, I don't know if there's specific wording on the status report, but essentially that it would provide a status report on August 25th on this work.
Yeah, and just for clarity, the school board motion and the one regarding the exemption to the guideline would both go up to council. The status report can be passed here at committee.
Yes. This is meant to serve in a different way. This is an outdoor recreation facility. We don't have anything quite like this in the city or in the region. So this is a different way for communities to activate their spaces. Because not every community is going to build a hall anymore. Let's be honest. Like I don't ever foresee a situation where the Rosenthal Community League likely builds their own community league hall, especially with the rec center site in the future. There'll be meeting space. There'll be other opportunities. So for communities to be able to more innovatively use their spaces, I think we should do that. And appreciate we've had some older policies that have set out why we wouldn't have done it. My hope through this, and I hope the impression everyone gets is that we are going to find every way possible to say yes. Unless there is legitimately a safety reason to say no, an environmental reason that stops something from happening, or the other parties cannot fundraise appropriately. Those, in my mind, would be the sort of three reasons not to do it. Every other reason we should be doing this, because this isn't just for this area. In my mind, if we can do this here, this is a model you can replicate in many other places. And as we start to think more differently about how we build out these 15-minute communities, we're going to need a lot more of things like this, spaces that can be used year round, that allow for different types of programming that are led by the communities too, because we don't have the resources right now to do this ourselves. So that's why I wanted to just really push on some of this here. You know, I would hope that when we come forward in August, we're at the last stage of it, which is here's how the funding is going to work because we've sorted out every other problem, and now it's just finally a council decision as to whether to advance that servicing work so that that site can be made ready for the community to go build a community amenity that I think, again, in this case, and worth saying, it is not just for Rosenthal. This is meant for other communities west of the Henday. This can absolutely be used by more than just that one space, and I expect it would attract people from across different areas. And again, hope that this very much can be a model going forward in other areas, recognizing that how we think about community spaces is evolving, both in terms of a post-COVID world and frankly, a financial world that doesn't really allow for communities to build out their own halls that they're going to have setting up. So hope that makes sense to everyone. Now that we've got the wording on the motion, I'm good with how it is, and let's help them succeed. Let's make sure they're ready to go. And I do want to give credit. I think I've heard from our team in administration that we're willing to do all of these things concurrently. So we're not going to hold anyone up. We're going to figure out a way to get them to succeed. And really the last thing that they need to do is deliver on the funding component. Thanks.
All right, thank you, Councillor Knack. And so we've got the wording of the motion, and we've got the opportunity to vote. So please vote now.
And just your vote, Councillor Paquette.
It's submitting. I am a yes.
Thank you. That's all the votes.
Please display the vote. And that is carried unanimously. Thank you, everyone, for that. And now we will be moving back to item 6.3. Almost 1 hour exactly. Nailed it. And we were going with questions of speakers. And I had some, but I believe there was someone ahead of me. So I don't know if we've got that list anymore.
I was just questions for administration. So.
Okay. All right. So I'll just ask a few questions of the speakers. And, you know, Councillor Nicol actually raised an important point, and that is that we did, especially last year when we had a little bit less maintenance, got complaints about weeds and garbage in the boulevards and just general weed growth in fields, which made it a little bit dangerous for little ones who are running around, you know, catching their feet, tripping, falling, sustaining injury, that sort of thing. And just the fact that people want to feel a source and sense of pride in their city. And to date, we've sort of got these almost, you know, monoculture plantings, be it, you know, a grass field or, you know, some basically non-native species planted on boulevards. So my question for the speakers is, how do you navigate that? And are there examples that you can give for how that can work effectively in a city with a climate like Edmonton, so that we don't have to resort to herbicide use in order to actually maintain a beautiful boulevard and beautiful public amenities? And any of you can answer. Dr. Farrell, if you want to start, go ahead.
I was interested in learning that as we warm, we also shift a little bit from parkland towards grassland. And so top of mind is some beautiful native grasses like the blue grama grass and others that children love with little eyelashes, and some of the needle and thread grasses and others. I think there's a lot of options. I think that, yeah, it's all in good design, keeping in mind health, environmental health, and keeping in mind ease of maintenance. Yeah, we need to really consider the twin crisis that we face. So I think, yeah, good permaculture design. And I think there's tons of engaged community groups. I think if we put a call out, we'd find many people would be interested in perhaps planting some rhubarb in some of those beds and being in those beds and spaces. If we're limiting the conversation right now to B-level shrub beds, that would be a thought.
Yeah, okay. Thank you. Now, you may recall that about a year ago, a motion was passed in council to explore more permaculture options for our boulevards and public spaces. And I think a lot of people hear that, and what they hear is what has been traditionally viewed as the naturalization of an area, which is basically letting it do whatever it wants, and it looks kind of messy. Of course, we've seen that over time, that naturalization actually turns into something quite beautiful. But those 15 years till we get there is a lot of people in the public feel is kind of an eyesore. So is there sort of a way that we can bridge that gap in a way that not only is sustainable but also aesthetically pleasing?
I think I want to say something to this, because if we're talking about an area that doesn't look good, that has garbage in it and weeds all over it, just by spraying herbicide, you're not going to improve that area. There's still going to be garbage there. There's still, what you're going to have is an area of just dead vegetation. So it's not just we just spray herbicides and suddenly we have this beautiful area. It just isn't going to happen like that. So if we want to look at what other municipalities are doing that have very similar climate zones, they certainly exist. Some of them haven't been using herbicides for cosmetic use for over a decade. So if we're wanting to know if those places exist, they certainly do. I did want to bring up one point, and that Edmonton is so lucky to have a bylaw for smoking. And when that was brought up to council, there was a lot of angst about that, a lot of people unhappy about that. And now that we have this, and we've had it for some time, people are quite pleased with that. It's actually just a matter of education. So a lot of this is around education, and some of it's about how it's going to take time to transition from like big expanses of lawn. Like I took out all of the grass in my front yard one year and put in all kinds of different vegetation. I put different things in there. And all my neighbors at first were saying, oh, perennials are boring. I thought grass is kind of like very, very boring in a way. But anyways, after a couple of years, all my neighbors started to do the same thing. They started to grow the same kind of landscape, and we were all getting nominated for Yards in Bloom. And I could go away for 2 weeks and leave my yard and not have to worry about cutting the grass. So it is around education, and it's not going to be one simple 1 or 2 sentence answer. It's a matter of looking what's already worked in other communities and going in that direction. Spraying herbicide never creates a beautiful landscape. It just kills weeds. It kills everything. So if you spray Roundup in a shrub bed, you're going to kill your shrubs. You're probably going to lose shrubs, and that's going to cost the city money. I want to point that out too, because if you spray it, you're probably going to kill the plants that you want to keep too. That's going to have a cost. So it's just not black and white, but there is a risk to using herbicide that doesn't ever go away. And it's clear that I've had a lot of people, there's a lot of science around this, and I've had a lot of people come and tell me stories about their children developing cancer and asthma and all kinds of things. So
I wonder if I could just add one thing quickly and just to answer your question, Councillor Paquette. I think naturalization doesn't take 15 years. It's actually pretty remarkable how quickly it does happen once you allow it. And it's also not just about stepping back and letting whatever happen. You know, there are ways, permaculture is one way, as you brought up, of designing so that you are creating beautiful steps in the process. And I think there's a real opportunity to do that here.
And I
All
think
right.
it goes without saying, by doing that, the people have appetite and the people connect to the land and the people connect to each other. And it kind of goes back to the first sort of order of business for today. It's a good way to make people happy.
Yeah. Okay. Well, thank you. I'm out of time. I mean, I guess conceptually I could be doing another round of 5 minutes. So, but thank you for answering my question. And I do agree with you, but I will say that the public probably has a perception that naturalization is a little bit problematic, but that's the perception. Okay, so moving on, we now, I want to thank you for coming out to speak. And I know you only came out for 10 minutes of questions, but we'll move on to administration now. And we've got Councillor Nicol up first.
Okay, Mr. Seabrick, given the report here, the 1.14 million in savings, that's basically a cutback of 17 jobs. Now, correct me if I'm wrong, 17 FTEs. And am I reading this correctly that with this cutback, are we increasing the use of herbicide?
So, Councillor, I'm just going to clarify. It was FTE equivalents of 17, which translated to 40 seasonals. So we didn't hire seasonals in that respect. And what we did, there was an increase. There was a change in the way the herbicides were used. So it wasn't just in response to complaints. It was on a routine routed basis. So rather than waiting for inquiry or a complaint about a specific location, what would happen is that those category of beds would get a regular frequency of treatment based on a routing. So it does increase.
Gord, it's a simple question. Did we, because of the cutback, did we increase the use of our herbicides?
Yes.
Okay. And okay, that's fair, Gord. Not a problem. And so I'll let Councillor, and we cut back 40 seasonals. So, but that was part of what you guys did. Okay, good. I'll let Councillor Henderson go, and I'll probably bring a motion back, Mr. Chairman, to use the put 1.14 million back using the FSR on a one-time basis.
Okay, thank you. Councillor Henderson, go ahead.
Well, my questions in going into this perhaps were a little bit more generic. When I saw this come up at budget, I was puzzled how we could get here, given what we passed in terms of our IPM, of our pest management plan, and I because nothing that I see in that plan suggests that we should make choices based on what's cheapest and easiest, and that seemed to me what we were doing. And I recognize we put pressure on you guys to do that. I recognize that we asked you to come back with budget cuts, but it worried me, given the commitments we were made in this plan, that that's where we could end up in this plan. And that's my larger concern here, is applying, which is really, it was about how that budget cut fit with what I thought we had proved in terms of policy and how we could end up in this place. Because I read through the policy and I don't see anything in there that speaks to cost. I see something in there that speaks to effectiveness. And I see things that are in there in terms of health, which is another thing I want to explore a little bit, because I'm not sure I see that in the makeup of our committee. But that was that big picture that I wanted to examine to see how we could end up here if we were truly applying rules that we had set out for ourselves 2 years ago. So your thoughts on that? Because I think, and if cost is going to be a factor, we need to have a discussion about that. But I didn't see it in what we'd approved.
So, Councillor, I'll probably ask Mr. Kennedy to add a little bit to it, but I think what we were trying to do, as you mentioned, is accommodate some budget constraints using what tools were available and sticking to what was permitted within the scope of that policy. So I guess in terms of interpreting the policy, we tried to stick to the, the overall goal of the policy without violating any of those conditions, knowing that there are a couple of different ways of delivering it. And certainly, we've been, I guess, gone down a path that would require more herbicide given we have less mechanical usage. So I hear where you're coming from, Councillor, and I think we were trying to just balance both the requirement for a funding cut as well as trying to stick to the nuances of that policy.
Well, I guess the reason I asked is because it was my understanding, and whether or not this is explicit in what we've done, is that really doing herbicide use, which has health implications or potential health implications, and the precautionary principle comes into this, was going to be our last option, and not, was one, because I'm recognizing that we have a responsibility around noxious weeds, which is really what we're talking about here. So that's why I just was a little bit alarmed that this came forward the way it did, because I still don't understand how that, and I would say it doesn't line up with our current policy. I don't know what we can do about it in the short term this year. The budget's gone through. But this is more about long term in terms of understanding, I think, how we're going to apply that. And it raises another question for me that I wouldn't mind your thinking on, is how we ended up with an advisory committee that has no public health people on it. And that seems to me, given what we set out to do here, I mean, there's fabulous qualified people on there, but we need a public health voice. That was part of the commitment we made. And I'm really worried that is, because that's the eye that will have a look at this precautionary piece, and it's just not there on our advisory committee. So that's the other piece of the puzzle that I wanted to raise here.
So in terms of the advisory committee, we did have a process based on some criteria, and Mr. Kennedy can speak to that a little bit, but we had a number of broad categories that we assessed all of the applicants on, and then based on a scoring, we picked the ones that scored the highest in accordance with those criteria. But I think to your other point with respect to the policy, I guess there's always opportunity if there's elements that we are interpreting incorrectly, we can look at providing more clarity through an update to the policy, if that would be the direction of committee and council, and certainly we would be open to that.
Well, at a minimum, I think we need to do that. That's why I asked for this report, because I was worried that clearly there was something that our understanding was different, I think, from what was being used to get us to this point in terms of what I thought we were getting out of that policy when it was presented to us 3 years ago or 2 years ago.
And,
so,
if there was more, specific clarity in the policy, then we likely would have not brought this alternative forward.
Understood. That's why I thought it was worth bringing this back for discussion. It was presented as, I don't think you snuck anything by us there. I just thought there was something that needed to be explored here. I'm out of time. I'll listen to the others and I may come around again. Thank you.
All right, thank you, Councillor Henderson. I don't mind waiting, so we'll go to Councillor Knack. I know that Councillor Nicol is on the board I don't know if you have some more questions, Councillor Nicol, or if that's for your motion.
I'll put the motion on, and then Mr. Seabrook can tell us what the outcome would be.
Okay, sure, that sounds great. And then we'll go with Councillor Knack.
Sorry, Councillor Nicol, are you making that motion first? I can wait till
to the city clerks, I would recommend, I'm going to move that 1.14 million be returned using the FSR to, Gord, what would I put it under? Back to your general budget?
It would be to the Parks and Road Services budget.
Okay, I'll put that motion on the table, and then I'll let Andrew and Aaron ask their questions on it. Using the FSR one time. You got the one time in there? Okay, good.
Okay, so the motion is on the floor. Do you want to introduce it at all, or just want to hop over to Councillor Knack?
Oh no, go ahead, ask the questions. I think it's pretty obvious what I want to do. So
yep, go ahead, Councillor Knack.
Thanks, Mr. Chair. Sorry, I just wanted to follow up on Councillor Henderson's question and about the membership of the committee. And I don't want to speak about any specific candidates, and appreciating we had one, but I didn't hear an answer to his piece around having health representation, having somebody with that expertise on the committee. I don't care who it is, but Mr. Kennedy, I think you unmuted, so maybe you have some insight you can provide, because it feels like that is a gap, and I didn't hear an answer to that.
Sure. Thanks, Councillor Knack. So I'll just take one step back, talk about the advisory committee. So it's a self-declared citizens at large group. They do not directly represent organizations or employers they currently or historically are affiliated with. The 12-member group that's currently in place represents rich diversity, integrated best management experience and interest from academia, industry, government policy development, and management. Members were selected from Edmontonians in a formal application process. No health professionals were among the applicants. In 2019, administration directly approached external partners from the federal and provincial government, including Alberta Health Services, to request participation in the advisory group, and due to their mandates, were not able to participate in an advisory capacity as indicated by C501A policy procedure. So, I mean, that said, anyone is invited to attend our advisory committee, citizens at large or other governmental representatives, but at this point in time, we don't have that representation despite trying.
Thank you. Maybe a bit more follow-up here then. So you mentioned the last applications were 20. How often do we appoint new members? Or it's not, I'm saying we, this isn't a council, obviously, it's administrative. So how often do you have new memberships, or what are the terms? And
it's, I believe 2022 is our next intake, but I need to verify that.
Okay. So if you're also watching all the camera feeds as I am, you might have seen a lot of confused faces when the answer came up. So it would feel like those who are obviously pretty engaged in this maybe feel a bit disconnected from what you've just shared. And I'm wondering if there's an opportunity to help, even between now and the next intake in 2022, if there's a way to help address that, because we've got a bunch of folks here with a lot of expertise, far better than I will ever have. And I know you have a lot of expertise, and I don't want to discount anyone who's on the committee. I don't know who's on it, but I just know that these are folks who have been involved, and I feel like we might be missing a bit of an overlap here.
So like I was saying, like the membership intake may be a little bit further off down the line, but folks are open to attend this committee whenever they desire. I think we meet on a monthly basis to talk and discuss issues of concern and issues of public interest. So open attendance there. So maybe that might be the intermediary step while we look at the
I think it would seem like because we should have the contact information for everyone who's registered to be able to send out a calendar invite to them, because I imagine just happening to know these folks, I have a feeling they'd be very interested in attending, even as public at large members in the short term. And then maybe when the time comes in 2022, being more active in that next step there.
Sounds good.
Okay, that's all. That's great. Thank you. I appreciate that part. I think that's it for me for now. Thank you, Mr. Chair.
Yeah, thank you, Councillor Knack. I'm going to shift gears a little bit in questions to the speakers. I referenced a motion from last year. The report's coming up soon about permaculture. I'm just wondering how these two concepts mesh, because it seems to me like they seem to be at odds with each other.
So I can take that one on. So since that motion was made, we've been diligently working on several initiatives and options and alternatives for landscape treatments. Councillor Paquette, including some of the references Dr. Farreau was making to making our open spaces available to groups that want to leverage them for things like food production or even permaculture plantings on their own. So we've been in touch with the Permaculture Guild. We've started a few small-scale FORB trials so that we truly understand the requirement of manual and mechanical labor required to maintain kind of a native FORB-based bed. And yeah, we're actively looking at ways to include additional opportunities for engagement with the public to utilize our open spaces across our inventory, up to and including shrub beds.
Right, but it seems to me that there are almost two entirely different approaches to how we would manage boulevards and different planting areas. So I'm trying to understand this concept, but maybe it's moot if this motion passes, but I'm still curious.
Well, so I think it's important to kind of take a step back and think about integrated pest management as utilizing the best approach given the environment and the pest and the threshold you're trying to seek. So I just want to give an example, like in a center median like 97th Street, efficacy of application is really important, as is worker health and safety. So that's a location where you want to get in and out of. And a lot of our B-level shrub beds are actually in and around collector and arterial roadways. So I think the short response to your question is it depends on the locations of the beds in terms of their applicability for what type of landscape approach you're going to take, whether that's volunteer engagement or creating some sort of agreement with a not-for-profit to utilize that land. They can be different types of inventory, and they potentially require a different approach as a result of that.
Yeah, so I understand that some areas are going to be more tricky than others for sure. Okay. The other question I have regarding the motion is, we're contemplating sort of dipping into the FSR one time to cover these costs. Is that necessary? Do you need that source of funding from the FSR? Because I have to admit I'm as perplexed as Councillor Henderson seems to be, that in all of the approaches to cost saving, this is the one that came out, even though it seems to be somewhat opposed to the general direction that we're going as a city.
So, Councillor, in regards to your question, do we need it? Yes, that money was removed from the budget, so the budget was reduced. In terms of why this was selected, again, when we looked across the corporation, all areas of the corporation were tasked with finding those reductions that would get us to zero as a city, and there were a lot of hard choices, and this certainly was one of them. And we didn't take it lightly. We tried to present the best solutions based on what the trade-offs were, and then present those for council's consideration, and knowing full well that it wasn't an easy decision for council either.
Yeah, no, I think everyone understands that administration was put in a very tight position here, where there weren't a lot of opportunities for big wins in any way. So I'm just curious, and maybe we can't answer this question right now, but just thinking about funding, like we had a much lighter winter than normal as far as snowfall, and yet I noticed the budget didn't really change. I'm just wondering if there's going to be a review of that, and if there's, I don't know if that's transferable, but if money from a lighter winter could be transferred into some of our maintenance during the summer.
So, Councillor, in terms of the snow budget, it's based on an ongoing review of what we're seeing with trends with snow. And it's not based on providing a service level for the worst winter, and it's not based on the lowest level. It's kind of in the middle. So we will see years where we are favorable, and we will see years where we're unfavorable. But what we've held true to is that whatever is favorable at the end of the year goes back into the FSR as was always intended. So it's certainly up to council what they would choose to do with that. Our recommendation typically is that the money goes back into the FSR.
Yeah, okay. So any funds saved from snow and ice would go into FSR, which is basically the pool from which we would draw these funds.
Yes, that's what's being recommended.
Yeah, okay. Okay, thank you. I see that Councillor Nichols is on the board. Go ahead.
So just a quick couple of questions here, Mr. Seabrick. Putting this money back into your budget, that'll put back, you said 40 summer temps, right?
40 seasonals, yes, that was the number we had last year.
And it would be a reduction of applying more herbicide, correct?
We would go back to the previous process of only using it in areas where there's a need to do it. It wouldn't be on a routine basis, just a response basis.
So it is a reduction.
A reduction from what's planned, yes.
And these individuals that we're putting back as temps are doing what?
Well, currently we don't have them now, so we would have to recruit those seasonals back into the workforce.
Can you do it within this seasonal cycle?
We will do our best. We don't know if we can get all 40 back. We would try and get as many as we could back as quickly as possible. And any seasonals that didn't return, we would likely hire temporaries and have to train them. But again, trying to do it as quickly as possible.
And given the COVID pandemic, you know, if you didn't use it up, well, then it would come back, would it not?
Correct. It would be a favorable variance that would go back into the FSR.
Okay, I think I made that clear. I'll just speak to it when you're ready, Mr. Chairman.
Okay, thank you. Councillor Henderson. Oh, sorry. Councillor Henderson, do you mind if Councillor Banga hops in? He hasn't asked any questions.
Not at all.
Okay, go ahead, Councillor Banga.
Thank you. I've got a couple of questions here. One is, first of all, let's see if the process goes through with this motion. We are putting back $1.14 million back into the system, turf maintenance. How soon are we going to do it? Because right now, I guess the dandelion season is in almost full bloom. Would it really matter after that?
So, Councillor, just to clarify, this doesn't address or tackle anything around dandelions. Dandelions are not a noxious weed.
Okay. All right. And so what this money is going to do?
So it would allow us to recruit the seasonal staff to do mechanical weed control in the B category of shrub beds. And perhaps Mr. Kennedy can just provide a little bit more context.
Sure. Councillor Banga, as I was mentioning earlier, there's 2 service levels for shrub bed maintenance in the city, 2-time service level and a 5-time service level. What that functionally means for the horticulture team is that 2 times a year, a team shows up on site with mechanical cultivation tools, be a reciprocator or a hoe, and they go through that shrub bed. The A-level beds are a bit different than that. They constitute 5 times, which means 5 visits by a team to those beds. They mechanically weed all of the weeds that are present in that bed, including regulated, and they move on to next site. So that's what the return to a 2-time service level would do. Would get us back to mechanical weeding those beds twice per year.
Twice per year. Okay. And my other question was in respect to, so how much less, I would say, as a result of this money injection, how much less, I guess, pesticide will be using? Like on a percentage basis, let's say.
Councillor, sorry, it's pretty difficult to prescribe that. Partially because as part of the integrated pest management, it's it's really a function of our routing and inspection of those sites that makes us cross the trigger threshold to treat or not treat. So we have some estimates for what's going to be required, but we really don't know the active ingredients required to treat regulated weeds until we actually assess the B-level inventory. So I can't respond to that for you currently.
Councillor, if you'd like, what we could do is take that away and do a little bit more assessment and provide you, Council, with a memo outlining what we would estimate that number to be.
Okay, no, that'll be great. And my last question, please forgive me for my ignorance there. What are non-regulated and regulated weeds?
I could provide you a couple of examples, but probably the easiest way to find the comprehensive list is actually go to the provincial registry as they register those weeds either way. But some easy examples for you. Dandelions are non-regulated. They are seen as a cosmetic weed. They don't require control under our policy. So an example of a regulated weed, like I mentioned earlier, Probably the most visible would be Canada thistle, although if folks are in natural areas, maybe they see things like burdock, or some folks might know about others like leafy spurge. But there's comprehensive lists available on the provincial website for sure.
Okay. All right. Thanks a lot.
Thank you, Councillor Benga. Councillor Henderson, go ahead.
Yeah, just to follow up on that really quickly, Mr. Kennedy, because the premise of that regulated list is things that can do damage to native species, to other species, to agriculture. I mean, that's the difference between a regulated and non-regulated is there actually is a risk to leaving those weeds in place because they overtake. They can invade the rest of the space and are slowly doing so. Correct? That's the premise behind that list.
Yeah. Yep. That's part of it.
Yeah.
Yeah, for sure.
So I just want to do a double check on what we get for 1.4 million, or what we would get for 1.4 million, because I think there's an interesting irony here, and it's similar to the dandelion question. Is one of the things we said with the dandelion, the best way to deal with it was to up our mowing cycles, which gave another benefit that we have the lawns looking in better shape and less unkempt. Ironically, we pulled back on those mowing cycles as well. I don't really want to talk about that, but I suspect the same thing may apply here, because if we send people in to actually do this, they will be able to deal with both the regulated and the non-regulated. They'll be able to do the cosmetic work as well, correct?
That's correct. Yep.
But if we're only doing the pesticides or the herbicides, we're only targeting the regulated weeds, and we're not even touching the non-regulated ones, correct?
Correct. There'd be a single cycle of mechanical, and that when we were in beds, we would only be targeting regulated species. Yeah, that's correct.
So ironically, if we're concerned about the look of the beds, we will get better service out of the mechanical, where you can deal with both the regulated and the non-regulated, than out of doing one cycle and then using chemicals on the regulated weeds. Correct?
We would be present in those beds 2 times in a year. The aesthetics, I don't think I'm the one to judge that.
No, and just to be clear, there's no intent to use the herbicides on the non-regulated weeds in those beds.
So in order to comply with legislation, as regulated weeds are brought to our attention, we do have a responsibility to control those. But you're right, if we're there more frequently with mechanical control, would likely reduce the presence or visibility of
all weeds. Yeah, yes. of all of them. Yeah. So, but my only other question then, and I had not, in asking for this motion, I had not assumed that we would necessarily be able to address this problem this year, because it's an ongoing issue. So if the only thing that it begs, I suppose, is if we're going to spend another 1.14 million, is there another way that we can spend that money? Because I think this is part of the point that was being made by some of the speakers, that will give us a better long-term solution to this than just going in and trying to hack them down twice a year, or spray them twice a year, or whatever that is. I mean, is this, in terms of the work that you're doing to try and shift ourselves to something that's sustainable at a lower cost, is there a better way to spend that money?
It's a good question. It's somewhat philosophical, but I think we are starting to shift the dial on this.
Which you're doing anyway with other resources.
There's two key pieces to it. One is shifting towards wide-scale naturalization, which the city has really worked closely with communities and partners on over the last few years. This year alone, transitioning 150 hectares of our manicured inventory into a more naturalized aesthetic. So we're stepping up to kind of transition ourselves in that way. But the second is with standards. And so we have standards committees that decide on the base allocation for shrub beds, for example, that go into our neighborhoods, our newly developed neighborhoods. And what we're trying to do there is shift away from this kind of standalone shrub aesthetic, where you plant a shrub and you surround it with mulch. And we're trying to move to more of a polyculture approach, where we use combinations of native species and attractive flowering forbs that create a semi-naturalized look, but still allow some aesthetic appeal as well as their contributions to biodiversity. So we're pushing hard with our partners in development industry to get to that stage where our standards kind of represent a more natural aesthetic, but is also still appealing to our citizens that are moving into these communities. So those two thrusts, we're really working hard to get there, Councillor.
So just to do a double check then, so if we want, if we did put this in, we would get probably better looking beds this year and would make those people happy, but we would also limit the use.
Yeah, it's still a 2 times service level, but we would be there with more frequency. So the weeds would be lower.
Oh, you're on mute, Councillor Henderson. And I think you're out of time, but we can come back.
Yeah, I'm out of time. That's okay. Sorry, something happened to my sound at this end. I might have to come around with one more question. Thanks.
Okay, it was fate intervening. So I've got a couple questions. So I think that what we're hearing from the community at large is a couple things. One, they're a little bit skeptical about naturalization because of what they've seen it look like while it's becoming something more full and robust. And so I'm just wondering if we're going to have maybe a different approach to how we implement that. That's the one question. And I'm just gonna, we'll do it one at a time. I'm not gonna give you 5 questions to answer. So go ahead with that one.
So, Councillor, in terms of how naturalization works, I think there's a couple pieces, and Mr. Kennedy can provide a little bit of detail on how. But I think one of the things we need to do, just like with any of the other programs that we deliver in the corporation, the ones that we have success on are ones where our citizens understand what we're trying to do. So what we need to do is look at how we can build in a bit of a communications methodology that allows citizens to understand not only what naturalization is, but also what the benefits are and what they can expect, and kind of what that transition looks like. Because I think that there was good points made about the fact that there is a period of time where it doesn't necessarily look like it's naturalized. It just looks like maybe it's unkept. So we have to get people understanding that it does take a bit of time, just like a construction project. There is a time where things are a little bit in disarray, but once we get through that, it is what it's intended to be. So, I guess my main point is that we do need to have some communications with our citizenry on this.
Yeah, okay. Yeah, I remember when things went in on White Mud down on the south side there, and for a long time, I heard a lot of complaints about it just from friends and family and people in the community way before I was in this job. But now, the parts that started many years ago look gorgeous. So the next question I have is so if we have folks going in to do those weeds, presumably they're also going to be picking up garbage. I know that seems like a really basic question, but this is one of the big concerns that residents have.
Absolutely. That's part of the shrub pass standard. Yes, Councillor.
Yeah. Okay.
And Councillor, in addition to that, we also have other crews that are strictly out picking litter. So
I saw a crew the other day, and they did a good job. They were even cleaning up a bunch of developer mess, which I thought was interesting. So maybe we want to, flag that for a few of our partners. Okay, so obviously the other thing that we're hearing from the community is they don't want just a reduction in herbicide and pesticide use. They want an elimination. And I'm assuming that we are on that path. We actually have plans developing.
So Councillor Paquette,
Now, I know that it sounds like a challenge, and like you would never want to say we're going to do complete elimination, but that's sort of the goal, right? Just like going to zero, with Vision Zero for trash, that sort of thing.
I want to maybe quote the policy in terms of judicious use, and I want to give you a practical example around pesticide application. So there's, when you move to some of these perceived safer applications, something like iron chelate, which we trialed over the last few years, to apply that, you need to add more active ingredient. It's basically just iron. So I just wanted to, in terms of the quantity, I don't know that that's the proper measure, because some of these lesser or perceived safer herbicides or pesticides, sometimes you have to apply in a lot larger volumes to achieve the same efficacy. So I think we maybe need to think a little bit differently about how we approach the discussion.
Yeah. Okay, that makes sense. But I just want to make sure that we got that flagged because it's something that's coming from the community. I get a lot of communications about that from, especially when I'm just out in the neighborhood. Okay. So, and the last question I've got is, do we need a motion for, or are we already developing plans for more community engagement in this sort of maintenance, either with businesses or groups or even individuals or community leagues, and maybe some sort of volunteer/funding program?
So I think the alternative landscape boulevard treatment addresses most of those points you just requested info on. So we may be 80% of the way there already with that former motion.
Okay, good. Because I know this is something we've been talking about for a while, and you never know if we need to re-up the sort of council direction on these things or not. Okay, it looks like I'm out of time, but it looks like Gord, you were about to say something.
I guess, Councillor, if there was a desire on committee's part to provide us with a little bit more direction to be specific about things like engagement, we can take that and work with that. But I think our intent is that we do want to move forward, as Mr. Travis Kennedy said, but we also know that we do need to bring our citizenry along. So that is going to be part of what we do going forward with not only this, but things like turf and all of those other elements to our green spaces.
Okay, well, maybe we'll have a quick offline about that, but I see Councillor Henderson is on the board.
Yeah, there was just one more thing I wanted to cover that is not necessarily covered right now in the motion. I really would, I think having read, and there are impressive resumes on the advisory group. I've read them all, but there is a huge gap. And I don't think we can wait another couple of years and feel that group is functioning the way it should without trying to find somebody to fill that gap that can speak with a public health voice. So I prefer to be a little bit more active about that. And I'm wondering if there'd be a way. I suspect if we went back to the community, a lot of people on the call here today, the meeting here today, could maybe beat the bushes and see if they could find somebody and make recommendations to someone who can fill that seat. But I'm really nervous about leaving it for another couple of years without that voice at the table. And I'm just wondering if that's a commitment that we can make.
So, Councillor, I think what we can do perhaps is take away when the term expires and maybe report back and give council an indication of when that would be. And if that's not going to be suitable, then we could look at what alternatives are to bring new people in.
Yeah, even one voice, and I think the whole point of an advisory group like that is not that everybody agrees with everybody. So I'm concerned if that begins to be a factor. I think it is an advisory group. It's not decision making, but it is one we depend on. And I think there's an important voice that probably needs to be part of the discussion. And I would suggest it's up to you guys. I don't think it's done by bylaw that if it means adding one more person to the existing group, I would argue that it's worth making sure that voice is there. It's an administrative group. I get it. But I really think there's a gap there that needs to be filled, and I'm very concerned that voice is missing from what otherwise is a fairly diverse table. But it's a pretty critical piece of the puzzle.
So, Councillor, I think we can take that away and look at what options or opportunities there would be to fill that gap. And perhaps when we respond back with the information that Councillor Banga requested, we could also include this information as well.
Great, thanks. Okay, well, thank you. That was my final question.
Okay, thank you, Councillor Henderson. And were you, just a quick question for you, were you hoping for a motion like that to be made today, or did you want to develop that?
I would be happy for the motion to be made today. I have some faith that Mr. Seabrook will follow up on it without a motion, but if he feels a motion would be helpful, I would encourage you to make one.
Okay, and just quickly, Mr. Seabrook, do you feel that would be helpful, or?
I think the sooner the better, but I think it would be better if we could make a little bit more of an informed motion that gives us a little bit of sense where we're at, what we need to gap. So perhaps we could take that offline, and that motion could be made at a subsequent meeting in the near future.
Okay, well, I mean, one option is that, this obviously will go to council, and at that point, that item could be selected and motion could be made at that time. Does that work?
I think that would work, Councillor.
Okay. All right, so maybe that's how we'll proceed. Okay, sounds good. We've got Councillor Knack on the board.
I was just briefly going to speak to that, just so if there's no other questions, I'll jump in.
Okay, and just double check. Councillor Nicola, were you just going to close, or did you have some questions?
Desperately want to close. Yes.
Well, that doesn't mean you get an early break. Well, it probably does, but go ahead, Councillor Knack.
Two quick things. One, I just from a governance piece, I would hope we don't actually have to make a motion for what Councillor Henderson's raising. I agree, because if this is an administrative committee, I hope we can just fill the gap through the initial process. But appreciate that. We'll come back when it comes to council. So I think I just want to echo his points and say I completely agree with that gap. And I think from an administrative perspective, you have the ability to address that internally without council having to provide direction. But if we need to, then so be it. That'll be the time. Just on the motion, very quickly. The other thing I was hoping when this comes back to council, since it's going to be a week and a half, because there's no council meeting next week, recognizing that we probably already would have hired the seasonal staff by now, and I appreciate Councillor Nichols' questions earlier on, which is that if you don't need the whole amount, you'll just return it. I also just think from a governance perspective, if you happen to have a more refined number in a week and a half, recognizing that you already know we won't spend that all because we didn't hire them in the normal timeline, I'd rather just have that number more accurately reflect what we think it would be. So I'm going to support this. I think it's a great motion. Thank you, Councillor Nicholl, for bringing it forward. But when it comes to council, if it's more appropriate for it to be to 900,000 or whatever the number is, I'd rather do it there instead of give you that extra and then just have it returned afterwards, just as a flag. So I'll support this. That's it. Thank you.
Okay, Councillor Nicholl, to close, please.
If he's closing, I wouldn't mind speaking before. Sorry, I didn't click on to speak.
Oh,
That's
Ben,
right.
you're killing me, man.
I'll be quick. I just want to, because I'm a little bit nervous about going into the FSR. It was not the reason that I brought this forward. I thought this year probably we were going to have to live with what we had to live with. But it's the longer term piece here about how we apply our own policies that I was way more concerned with. So I think we have a longer term issue here that we still need to be able to deal with. And Mr. Seabrook, if you need more clarity in the policy around that, I think that would be really useful for you also to bring back for us, because that really was the larger question I wanted to deal with. I'll have to think about, to be consistent. I was concerned the last time we dipped into the FSR for something like this, and I'll have to have a long, hard think of this because I think this is something we should be doing. But I just want to keep in sight that this was about looking at that long-term piece, and if we need to create more clarity for you in the policy, then please bring that back to us so that we can do so for you, because I think we probably got off track here. So thanks. That's all I wanted to add.
Yeah, thanks, Councillor Henderson. I'll just quickly say that I agree, but I also, because, I think that because of our lighter winter, that money does transfer, and it's unusual times, and that's, I think, why I'm supporting this. Otherwise, I'm traditionally extremely loath to dip into FSR, but I think this applies in these times. All right, well, Councillor Nicholl, you've been patiently waiting.
I just want to make sure, is there anybody else? Okay. Good. Well, Councillor Henderson, don't feel too bad. Don't feel too bad, because this report highlighted an outcome that was an unintended consequence of the budget. And so with this motion here, I think your conscience can be clear. So let's just focus on the outcome. What we are getting is putting 40 temps back to work. We're getting cleaner beds, and we're reducing our herbicides. Those are all good, positive outcomes in the short term. That's why I'm only doing it on a one-time basis. And these are pretty crazy times, as you know. So I would like to remind everybody, we threw in a $40 million surplus into the FSR from last year. So there's money there. There's money to be had. And these are three good positive things. So hopefully I can convince Councillor Henderson to come around in about a week and a half to support this. That's about it. Thank you.
Well, it depends how nice you are.
I try my best, but sometimes.
All right. So if there's nothing else, let's vote.
And Councillor Paquette, it seems your vote's not coming through.
Yeah, it's I got the spinning wheel of patience. I'm a yes.
Thank you. That's all the votes.
And that is carried. And that takes us to 322. So we've got a couple options. We can hear a presentation from administration, then go on our break. Is anyone opposed to that?
No, that's a good idea.
Okay. So we've got the Orange Hub 6.4.
It is a very
And
short.
there may not be a presentation.
No, it's a very short presentation.
Okay.
Just provide a few highlights on this item. I am here with Roger Jevney, as you know, branch manager of our Community and Recreation Facilities branch, for the presentation. And for questions, we have Stacy Padbury is on the call, our deputy city treasurer. I believe Chris Hodgson is here, branch manager of real estate, Marco Hoffner from law, and Judy Rahovi and Ellen Finn from Rogers Branch Community and Rec Facilities, both of whom have been instrumental in working with the tenants at the Orange Hub and preparing this report. Just quickly, by way of background, late in 2020, administration and council became aware that due to the impacts of the pandemic, a number of the organizations at the Orange Hub were struggling financially and at risk of ending their lease at the facility. Council then directed that administration work with the tenants to determine how the city could provide one-time funding that would allow them to remain at the hub and really continue to build on council's vision as a community hub for arts, recreation, education, and wellness. So just quickly pass it over to Roger to present the funding proposal to support the tenants at the facility.
Sure. Thanks, Rob, and I'll try and be brief. We are here today to seek your approval or your recommendation to City Council to create a one-time operating grant for the Orange Hub tenants to help offset the financial impact of COVID-19 on these organizations. The proposed grant programs outlined in our report with additional details in attachment 3 of the report. Briefly, I'll just provide a few highlights. It is a one-time operating grant for 2021 only. This opportunity is available to leaseholders at the Orange Hub who've experienced a decrease in their operating revenue due to COVID-19, and a budget of up to $180,000 has been identified in the Citizen Services 2021 operating budget to fund the program. The proposed grant program was developed in discussion and consultation with both internal city stakeholders and the organizations at the Orange Hub. The program is intended to fill the gap in relief funding that may not be addressed by programs established by the other orders of government, and will directly support City Council's vision for the Orange Hub as an interagency community hub for arts, education, recreation, and wellness services for Edmontonians. So that's it for now, but we'll of course be happy to answer any questions you've had once you've heard from the speakers.
Okay, well, thank you very much. I guess we'll take a early break, and if that's okay with everyone, to come back at 3:40 instead of 3:45, and then we'll hear from speakers. All right, thank you. See you in a bit. quick roll call. Zadek there, looking bright and chipper. We've also got, let's see, do we have Councillor Knack? I see it. Ah, there you are. Hello. And Councillor Nickel, are you there?
Good afternoon.
All right, good afternoon. And of course, we're joined by Councillor Henderson. Hello. Hanging in there. Councillor Cartmel, you doing all right? I think we made him fall asleep. Councillor Banga.
I'm still here. Thanks.
And awake. Good for you. That's impressive. All right. So we are now moving to speakers on our item. And first up, unless there's been any revisions that I'm unaware of, is we've got Kara Bedford. And you may be on mute. I don't know. None of us are getting your audio. No. Do you mind if we swing around back to you? Okay, and we'll get the clerks and you to see what you can put together. And we'll move to Elise Graham.
Hello, can you hear me? Everyone can hear me?
We can hear you.
Lovely. Thank you so much, Council, for having me. My name is Elise Graham. I represent WIFTA, Women in Film and Television, Alberta. We are a nonprofit organization run entirely by volunteers. We support, advocate, and promote women, femme-identifying, and non-binary individuals in the screen industries. We moved into the Orange Hub in 2019. It was huge news in our industry that the city had invested in this innovative vision and that FAVA and the ESIO had also moved in. We aggressively sought space here, and I feel it added a tremendous amount of credibility to our organization, as well as the connections and potential for collaboration. I'm also on the advocacy committee for the tenants of the Orange Hub. I joined very recently after it was identified by our organization that our operational funding will fall well short this year. I attended one tenant meeting, and I was so moved by both the passion and camaraderie of the tenants and the work of the admin that I am fully bought into this process. What I saw in that meeting was, of the tenants that have demonstrated the greatest need, they are all women-led organizations that support women and marginalized communities. These groups support the 2S LGBTQ+, they acknowledge intersectionality, and are overcoming systemic barriers all the time. But the pandemic has brought down an unprecedented challenge that fall most heavily on these groups. We know, and it has been demonstrated the world over, that women have been disproportionately affected, and we see that now reflected in our Orange Hub community. This is why you will see reference to the Gender-Based Analysis Plus lens being applied to the grant administration. We are unique. The Orange Hub is unique, its tenants are unique, and our relationships are unique. And it was because of the city's vision for this building. We know that the vision is achievable. In order to ensure that the Orange Hub is viable, we need to address the systemic barriers that disenfranchise those most affected. This grant program is an essential part of the continued good work of the city and this council to actionably uplift those diverse organizations that give Edmonton its vibrant and dynamic social and economic identity. The tenants have been collaborating at council's request, coming together with administration to champion this one-time relief grant. I'm extremely optimistic about this grant program. I feel that it marries perfectly with the building. And I ask council for your continued support moving forward. And thank you so much for this time.
Well, thank you very much. And we'll try Kara again. I hope I'm saying it right. If it's not Kara, but either way, it's great. But Kara, we'll give you another try. And can see that you're on mute right now. Okay. You know, unfortunately, we're not getting your audio. But I'm assuming that you're speaking in support of the item here.
Mr. Chair, often if you sign back out and sign back in, the audio will magically work.
Additionally, our office will reach out and provide the phone number that can be dialed into.
Okay,
I don't know if it would be out of line. I do have Kara's written statement with me that I could read on her behalf if that was acceptable.
Well, you did have an extra 2 minutes in your time. So I think if that's the route you want to take, we're open to it. And in the meantime, Ms. Bedford, if you could sign out and sign back in case there's questions for you. Okay, go ahead, Elise.
Thank you. Just let me. So imagine I'm Kara. Thank you, Council. My name is Kara Bedford, and today I am here as a representative for the advocacy group for the tenants of the Orange Hub and as the marketing coordinator for Gateway Chorus, a nonprofit that has humbly served this community for over 60 years. This is now my third time coming before you to discuss the unique situation at the Orange Hub, and both times I used the term symbiotic. And while this word still does describe the ongoings and collaborative efforts from the administration of the Orange Hub these past months, I will be using a new word today. Administration has done what council asked of them. They have created a program that fits the very unique needs of the tenants, all while supporting the original vision of the hub. So the word I choose today is now. Now is the perfect word to sum up the urgency we face as tenants. Now we have a plan in place, and now it's time to move forward to implementing that plan with this program. We have been meeting with administration week after week in an open and transparent format. Tenants told their unique stories of community while addressing the true struggles that we have faced during COVID-19. There were consultations on barriers, including addressing the fact that those in immediate need are all women-led organizations, many of which are supporting children, youth, and vulnerable populations. We, the tenants, are asking for the approval of this program, and I want to take a moment, say some thank yous to the administration staff. Ellen, Sherry, and Colin, thank you so much for your time in getting us to where we are now and for listening. 20, 30, 50, 60. Those numbers are many of the tenants' tenures in Edmonton. We have invested in our communities, we have invested in this building, and we believe in the Orange Hub's vision collectively. The tenants of the Orange Hub have come together in the worst of times, but now with your approval today, we can come out of COVID still together. Thank you very much.
Thank you, and that was exactly 2 minutes. It's impressive, but what else can you expect from someone who has 9 3/4 on their wall? Okay, so we have heard from our speakers, and I'll check to see if there are any questions. And I am not seeing any, which means that
I've give me a chance here, Councillor Paquette.
Oh, okay. You have questions for the speakers?
Yes, just real quick to all the speakers, it's option 1, which is the preferred, is the administrative recommended option. Are we all good with that? Okay, when you're ready, I'll put it on the table, Mr. Chairman.
Okay, thank you, Councillor Nickel. Councillor Knack, I saw you briefly on the board.
I was ready to move it but it doesn't matter. It's Orange Hub. I have a fond place for, but it doesn't matter.
If you want to pull a fast one, now's your chance.
Nope. Councillor Nickel said he's going to do it.
All right. Okay. Well, so I believe that Councillor Nickel has already moved it anyway, and it's on the board. And yeah, it looks good to me. Any questions for administration? No, I think we've really debated this one into existence. Councillor Knack, you're still on the board.
Speak briefly.
Just to speak, and I'm assuming Councillor Henderson, you're to speak as well? Okay.
Yeah, and I just have a quick question for Mr. Smythe.
Okay, go ahead, Councillor Nickel.
Mr. Smythe, under risks, how do you,
how do you feel about the likelihood of when grant funds are released, despite established parameters of use, they could be applied to ineligible expenses? Is that high, medium, or low in your opinion?
I mean, it's only an opinion, Councillor, but I would put it in the low category. I mean, I think the due diligence they've done, we're good. We're good to go.
It's just a question because it's mentioned in the risks. Okay, thank you.
Okay, perfect. Well, okay, Councillor Knack, go ahead.
Thanks, Mr. Chair. Just briefly, I want to thank both our administration and the tenants over at Orange Hub for working on this together. The reason we brought this forward in the first place was because the worry was, you know, if we didn't have something like this in place, we were going to lose tenants, and we aren't going to fill the building. It's not like we're not going to fill it with anyone else right now. So better to do this, get through this very challenging time, and immediately have tenants who are still able to then pay at the appropriate time, than to just have to go find new tenants from the beginning. The whole point of this Orange Hub is that we've been working to fill it up. It's pretty close to full now, although operating quite differently during COVID times, and some folks aren't operating at all right now. But as soon as we're out of this, we've got a pretty close to full building now, with tenants who are doing some incredible things. And I just love the fact that everyone is working so closely together now. There's so many unique opportunities that are coming from the Orange Hub. The Orange Hub is quickly becoming one of my favorite buildings in the entire city because it is so unique compared to what we have across the city. So I don't expect any pushback, but just in case anyone was hesitant to support this grant, which I don't expect from the committee, I would encourage you to support it. Let's allow this building to stay full and then open up with all of the tenants currently in place, and allow it to really get to that point that we've been working towards and was reaching prior to COVID. We were getting pretty darn close to where we wanted to be even beforehand. And I think the last piece, just in case anyone's hesitant, remember when we brought this forward, we were saying that with the current occupancy, we were pretty much, I think we were even at the break-even mark. I thought it was 85% or something like that. We were it was 85% of what we were there. And that's pretty great for a building that was one of the goals, is to find a new way forward. And that's with providing this benefit. So hope everyone supports it. The Orange Hub is a wonderful building. If you haven't been there, when you're allowed, go and visit it, because it's fantastic. Thank you.
Thank you, Councillor Knack. Councillor Henderson, go ahead.
Just really quickly, I don't want to add much to what Councillor Knack said, but just a thank you to administration. I've heard nothing but good reports on the creativity and the willingness and the goodwill that was put into to help people out in a troubling time and to come up with a solution. I think that will be to their benefit and ultimately to our benefit as well. So thank you for making that work. I know it was unusual, and I think that your dexterity is appreciated.
Yeah, I'll just add my voice to that as well. I think this was really a team effort. A lot of folks who are being affected positively now by this put in a lot of work and a lot of sweat and tears. So that has not gone unnoticed. So thank you for that. And just on record, I liked the Orange Hub building before it was cool, Councillor Knack. Back when we used to compete in the Kiwanis Festival. So some of you might know what I'm talking about. At any rate, I'm really grateful to everyone, and I'm ready to vote, and I hope everyone else is as well. And just put out a final call for anyone else who wants to say anything. Sorry, Councillor Knack, you can't offer a rebuttal, so let's vote.
I could offer a point of privilege and to say, but I won't.
Noted. It's the end of the day, and I still got that banger from that presentation in my head. I'm not able to vote. Oh, there we go.
Your still isn't coming through, Councillor Paquette.
Yeah, okay. Well, I'm a yes.
Thank you. That's all the votes.
And that is carried unanimously, and that will go to council. All right. Well, thank you, everyone. I believe that's everything. So I will just see, if I did not get any notice of motions.
We have 7-1.
But, oh my goodness, I almost forgot about someone. It's all.
I believe we have a speaker
It's
too.
stuck right in there, really, really tiny. So I almost missed it. Thank you, Councillor Nickel.
How quickly you folks forget me. It is shocking.
Never forget you. You're always on my mind. Okay, that's not true. I can't stand by that. But I remember this. So let's go ahead. Item 7.1.
Good afternoon, committee. Stephanie McCabe. Administration has a short presentation if you'd like it for the designated driver service item.
Yes, I would like one quick one, Stephanie, if you don't mind, please.
Yeah, no problem. So YC Ramirez, the General Supervisor for Business Licensing is here. Kim Petron, the Branch Manager of Development Services, as well as Lila Pita, the Director of Development Approvals and Inspections. I'm going to pass it to the team to do the presentation.
Great, thanks, Stephanie. Administration was asked to bring forward the current operational requirements within the City of Edmonton for providers of designated driver services. And a designated driver service provides 2 drivers to transport the customer and their vehicle to a specific location, as well as to transport the 2 drivers to the business base of operations. Designated driver services are one of the many ways that the city plan outcome of a safe, secure, accessible, and responsive mobility system is delivered in Edmonton. I'll pass it over to YB.
Thank you. As the designated driver service is dependent on the citizen requiring their vehicle to be transported along with them, the service differs from a vehicle for hire service, which offers private passenger transportation service in the vehicle for hire driver's vehicle. The vehicle for hire bylaw 17400 governs when a motor vehicle is used or offered for the transportation of at least 1 passenger in return for compensation from any place within the city to a designation either within the city or outside the city. The designated driver service is only provided when a motor vehicle requires transportation, and therefore the service is regulated through the business license bylaw 13138. Provincial vehicle safety and operating requirements apply to all designated driver services in the same way as other Alberta drivers. This includes a requirement for the customer's vehicle to be properly registered, insured, and mechanically safe, and that the driver properly is licensed. Thank you. Would be happy to answer any questions you may have.
Okay, well, thank you very much. Councillor Nickel, go ahead.
Did we not have a speaker on this item?
Did we have a speaker? Did we add one afterwards? Oh, we did. Mary Dumais. Thank you. It's in my notes. You're right. We did add that after the fact. Go ahead, Mary. You have 5 minutes.
Mary, are you here?
Thank you very much for having me here today. I just have a few concerns when in regards to designated driving services here. You guys were mentioning 1 passenger. Sometimes we move families, right? And everybody has to ride in their own vehicle. And also the other concern I have is the insurance aspect. For the following car, so as we have a fleet of vehicles, so the insurance for the following car, plus the CGL policy. As you know, Grand Prairie has regulated designated driving service out there, and now we're hoping that Edmonton will regulate us also. Thank you.
All right. Thank you very much, Mary, and thank you for your patience today. We'll now move to Councillor Nickel to see if there are any questions.
Yeah, I'm getting there. Okay. So Mary, we've talked about this a little bit about how this is not, it's not the same as, for example, me driving my friend's vehicle home right after we've been out, for example. This is something in between a full-blown taxi, the service you provide, for example, and that situation that I'm speaking of previously, correct?
Correct.
And as you understand it, maybe describe your service right now, and you maybe elaborate a little more on your concerns, because there are other providers out there that you feel that don't have the same sort of standard that your operation functions under?
Yes. So I started the company 9 years ago. It's a family-owned company. So we had to ensure that we have insurance for our following vehicle. And we also, like I mentioned, a CGL policy. So in case anything happens, that the drivers aren't held liable, the company will. The other DD services that are in Edmonton that operate, there is 11 of us. Now, one was they would be considered subcontractors. They would get their subcontractors to use their own vehicle, which would be personal insurance. Now, with personal insurance, if you get into an accident or if anything happens, the insurance company can void your insurance, and the owner of the vehicle is on the hook. The subcontractor's vehicle would be on the hook for any damages or anything that happens drastic. As for us, we have all the insurance that's required for our drivers, and if anything happens, our insurance will kick in. So we protect our drivers, and just like we protect the public. It's public safety out here. So we just go ahead.
Mary, as you understand it, then it's your contention that a business license is basically insufficient to guarantee safety and security in case of an accident, because the insurance could be voided at some point, given that it's a personal vehicle.
Correct.
Okay. Are there any other, and I'll ask administration about this gap, because it's very similar to a conversation we had with regards to taxis versus, Uber and so on as we go down the pipe. It really does boil down to the question of insurance, doesn't it?
Yes, it does. It's public safety. And along with our drivers also have to have a police clearance, and they have to supply a driver's abstract, because all of our drivers have to be on our policy.
Is there a fee for your company or for these other companies? Do they charge a fee with regards to provision of this service?
Yes, we all charge a fee. Each company that's in the city of Edmonton, including ourselves, we all charge a different amount. So we charge by the distance. The other companies in the city of Edmonton charge a flat rate. So there's a lot of conflict there too. But it all boils down to is we're doing our best to get people home so they're not drinking and driving. So, and this is where our big concern is we are doing everything legally. The other companies here in the city of Edmonton, they could be here for a week and then they shut down. And the city of Edmonton, we ask them, even when it comes to our business license, currently I used to be under transportation courier, and now I'm under general business. There wasn't any consistency, and I would like to see consistency for designated driving services throughout Alberta. Grande Prairie, like I said, has implemented it, passed on May 1st of this year. Now I would like to see, all the DDs follow the same rules and regulations that the city of Edmonton will put out.
Okay, thank you.
Thank you.
Okay, I think we have more questions for you from Councillor Knack.
Yes, thank you. Sorry, just I think one I wanted to double check. So, because my first reaction when I heard that is like, oh, okay. Like, my worry is if you set up so much and you create a bunch of regulations, does that actually prevent the opportunity for these services? To do what they need to do. But so I guess my question is, recognizing that you've mentioned Grande Prairie recently brought this in, has that been a major issue? Like I just, in my time on council, I haven't had people raise this before as a concern. So I wanted to get an understanding of sort of the scope of the problem that we're dealing with to make sure that we're figuring out what the right solution is.
Was that for me?
Yes, sorry. I just, since you've brought this idea forward and it's a new idea to me, and I want to understand, has this been happening for years and there's been inaction from the city? Has there been a lot of safety concerns raised from other companies because they haven't had these same type of rules and standards that you follow?
Yes, in Grand Prairie, I guess in Grand Prairie, they were fighting among each other. They were undercutting each other. They were going up against cab companies. So the city had enough and said, okay, we're going to implement a bylaw. As for Edmonton, we've had the same issues here in Edmonton. We've had it where, and I'll be straightforward with this one, we've been accused of a couple of things. One was for making sexual comments to, we were accused of making sexual comments, but it turned out that it wasn't even our company. It was a totally different company. We've been accused of damaging vehicles, and that wasn't even our company. It's a big battle out here, and it's a public safety. And for us, it's like they go outside the bars and they pick up people, which we're not a cab service. They all have to call the dispatch line for us. All of our cars are GPS coordinated, so we know where they are at all times. We're very big on safety. We have policies and procedures put in place, just like any other company would. Now, the other companies, it's like I said, they just hire random people. You can use their car, and if anything ever happens, then it's going to be an uproar for everybody here, especially if it's something that's been like a massive accident.
Okay, that's helpful. Thank you very much. I appreciate your time.
Thank you.
All right, thank you, Councillor Knack. Councillor Nickel, another round?
Just for administration.
Okay. Well, Mary, thank you very much. You've helped clarify the situation. We really appreciate you coming out. We're now going to move to administration to ask questions. You're free to stay on the line and listen to how things unfold.
Thank you.
Thank you. All right, Councillor Nickel, go ahead, please.
Well, thank you very much, Mr. Chairman. I guess the question has always centered around the level playing field and the issue of insurance. If we are issuing a business license, and if they are collecting a fee for service in this transportation field, does administration feel that, or think there might be a gap here that needs some coverage in the bylaws?
Councillor Nickel, no, not at this time. We do believe that the business license bylaw covers us off in this area. And I know we have Nancy Jacobson on the line who could speak more to the insurance aspect of that.
Ms. Jacobson?
Thanks, Councillor Nickel, and thanks, Ms. McCabe. So in terms of insurance requirements right now, when someone is driving your vehicle by consent, it would be your insurance that prevails. If we're looking for a higher standard than that, that is where we would step in with a bylaw amendment.
So, Ms. Jacobson, my question to you goes to that, okay, it's a business, and basically it becomes a virtual vehicle for hire. Does that not suggest that the vehicle for hire insurance standards would apply?
They don't directly align under the way the provincial regulation is written, but I would draw a distinction here between, is this something that we want to regulate as a vehicle for hire? And we certainly can. We would do that under that bylaw, and we could impose very similar insurance requirements, but they fit in a slightly different space just because of the aspect of the fact that you are driving a vehicle that is owned by someone else, and it's that consent piece.
And I think, Ms. Jacobson, I think you hit it on the point. It's really in between the spaces. And I'm not advocating one side or the other, but if committee is, because it is a concern, I would like give direction back to administration to speak to the industry and investigate it a little further. If we do want to do this, it is about setting a higher standard, no question. But that is, before I go ahead and make that leap, because Councillor Knack does make a point about overregulation and is it necessary? I personally feel it is, but that may not be the feeling of council or others here. So I think that's what I would like to do, because I am concerned about a level playing field. If there are no other questions, I guess, Madam Clerk, I'll make a motion to administration to discuss with industry the pros and cons of an addition to the vehicle for hire law amendments, additions to the vehicle for hire bylaw with regards to designated drivers and insurance requirements. Does that make sense?
I'll get something drafted for you, Councillor Nickel.
I have a question to ask? in regards to Nancy's comment.
Oh, we can't do that now, Mary,
Okay,
because
sorry,
I'm
okay.
not administration.
Okay, sorry.
About that. So if we could get that up there, and as we get that up there, I'll just speak to this. It is an in-between thing, absolutely, and but I will not dismiss it because it's an in-between thing. There is a very serious balance between the necessary need for proper insurance and regulation, and then putting an onerous requirement on any type of industry. I'm fully aware and cognizant of that. That's why I'd like administration to go back, look at the Grand Prairie regs and so on, and maybe explore this a little more. That's kind of my opener, Councillor Paquette.
Okay. All right. Thank you. You never know. Don't interrupt. So we've got Councillor Knack on the board.
Yes, maybe to the mover first, just to double check. Yeah, I think I'll ask it as a question instead of speak to it. The motion specifically asked to work with the designated driver services. I'm just wondering if there's a place for groups like MAD to be involved, because I truly don't know if there's. I don't want to create a situation where we're actually discouraging people from using designated driver services. So, and I don't know if organizations like Mothers Against Drunk Driving or other thing would have insight into any work there. And was that your intent to have them involved at all, or to reach out?
Well, we start with the basic model, Councillor Knack. You call somebody to pick you up so you can drive someone else to drive your vehicle home. That is what's at issue. Who gets the phone call and how the transaction manifests itself is, I'm not prescribing at this point, but it's worthy to know. Those are two organizations worthy to know.
Yeah, so maybe just in speaking to it then briefly. So I would support that, just with the recognition. I'd want it. My only hesitation, and this is my immediate reaction, was I worry that if we regulate this, does that actually discourage people from using it? And I don't know how widespread an issue it is. I'm going to take Councillor Nichols' word for it that it sounds like there's a concern. While I haven't had it raised on my end, I respect that's come up. I would just hate for us to actually create a situation where people are feeling less willing to do that. And this is probably that risk conversation that we have on a bunch of different things. You know, what's our level of risk we're willing to accept as a city based off the outcome and the risks of not having people use those services. So as long as there's an openness for administration to reach out to a couple of those organizations that might have a perspective on designated driving services beyond the ones who are actually providing it, I'll support this motion just to make sure that we can get all the information available to us. So thank you.
Thank you, Councillor Knack. Yeah, I'll just quickly speak to it. I'm not really a big fan of adding more red tape to things, but in this case, I think I don't mind getting more information. It may end there, but it may actually provide something of utility to the industry and to Edmontonians in general. And I'll just leave it at that. It has my support. Councillor Nichol, did you want to close?
No, both of you have just spoke eloquently or shortly on it. I think it's you're absolutely right. Let's see where it goes. I think that's the honest answer, because we don't want to kill business. But then again, I would hate to see the industry melt down because of a bad insurance regime, if you want to put it bluntly, right?
Okay, well, let's vote.
I appreciate how it wasn't eloquently and shortly. It was one or the other, which means one of us is eloquent and the other one was short.
You can sort that out for yourselves.
Just waiting for your vote, Councillor Paquette.
It's submitting. Councillor Knack, I think you claimed both prizes. I'm a yes.
Thank you.
And that is unanimous. Now, wonderful. Are there any notices of motion without customary notice? Because I always forget to ask that. No, none? Okay. Well, thank you, everyone. Thank you, everyone from administration. Sorry to add more to your plate today, but it's the way the world goes. And